Good morning, everyone. So, welcome to this PSM LRR INI-CET session. But of course, if you're a NEET PG aspirant or you're an FMG aspirant, you're very welcome to attend this session, guys. This session mein, I will be targeting a lot of MCQs. It's completely an MCQ based session. We will be looking at the MCQ, we will be looking at the answers, and I will be trying to give you some extra points along with this. So the session can go up to 2.5 hours. So sit down with a cup of coffee, with a cup of tea. Also, just try to solve the questions along with me. It is going to give you an overview of the PSM today. All right. So can I have a thumbs up from all of you? Good afternoon. Great to see all of you guys. So can I have, errors, everything will be covered. Basically, see, we will be talking majorly about biostats, EPID, national health programs, screening, those and numericals. We are also going to solve a lot of numericals today in this session. We are particularly directed towards focusing on acts, which are favorite of INI-CET exams. But then a couple of you did message me that if you're NEET PG or you're preparing for FMG, you're most welcome to attend the session, guys. Okay? So can I have a thumbs up from all of you and let's begin. PDF क्लास के बाद पक्का से मिल जाएगी आपको. Don't worry. Just stay focused. Enjoy the session, everyone. Okay. Let's start, everybody. So the first question today, I thought I'm going to start with the numerical only. So let's see if you can solve this question, because nowadays INI-CET, if you look at the last INI-CET paper, which was the latest, the last one, you will see a lot of questions were there from biostats, a lot of questions were there from numericals. Okay. So that's how I have also designed the paper today. We'll give it an overview. So biostats bhi hoga. So let's look at the question here. Calculate the maternal mortality ratio for the year 2024 given in the following data. Now I hope all of you remember what is maternal mortality ratio, guys. So if you remember what is maternal mortality ratio, so for maternal mortality ratio, numerator is not a part of denominator. So, and maternal mortality ratio is the only formula, or maternal mortality rate and ratio both, only formula where the multiplier everybody is 1 lakh, right? The multiplier is 1 lakh. So it is total number of maternal deaths. It is total number of maternal deaths per 1 lakh live births, per 1 lakh live births. I hope you remember this. And for maternal deaths, you have to consider the deaths during pregnancy, during delivery, and up to 6 weeks post delivery. But you have to exclude what? You have to exclude accidental incidental causes. You have to exclude accidental incidental causes. So now all we need to look at what are the information that has been given to us. So total women who died is written 6. So don't immediately put the numerator as 6. No, you have to look at the causes of death. If you see one died due to road traffic accident, so will you be counting road traffic accident? No, this is not counted. It's an accidental or incidental cause. One due to sepsis, we will count this. Obstructed labor, eclampsia, ectopic pregnancy, we will count this. But we're not going to count snake bite. So what is the total number of maternal deaths over here? That's what I'm saying. Don't be in a rush and don't immediately put 6 as the numerator. Okay, it's going to be 4. And what is the total live birth? Very easy. It's been given to you. 4 upon 4,000 into, guys, we will have 1 lakh. So if you solve this, ideally it's going to come 100 per 1 lakh live births. Okay, it's going to come 100. So your answer over here is 100. Everybody got this question? Can you all, did you all understand this question, everyone? Okay. One more thing, guys. Whatever doubts, whatever questions you have, just note it down. Once we finish this session in a span of a couple of hours, I will take up all your doubts. In case those don't get answered in the session, you can definitely ask me at the end of the session as well. Is it okay? Chalo. One more point over here to be noted. If it was rate, what would have been your denominator? Women in reproductive age group. So just point to be noted, exclude accidental incidental causes. Now question number 2, again one of the good questions, because INI-CET, if you look at the past year papers for INI-CET, they have been asking these questions also. Just wanted to give you one-liners here. Among the following, best indicator of health in a community is MMR, IMR, life expectancy, NMR. So remember, best indicator of health status in a community, socio-economic development of a community, it is IMR. IMR is the best indicator for availability, utilization, and also effectiveness of health services. Availability, utilization, and also effectiveness of health services. But what was the catch? If you remember our videos, if you remember our discussions, what was the catch? If they add the term UN, if they add best indicator, suppose question aa gaya best indicator, okay, best indicator of health status, but they add according to UN, okay. So don't be in a rush while doing your questions. Agar according to UN likh diya, U5MR, theek hai. One more point I wanted to discuss over here. I want all of you to put your answers in the comment section, guys. Best indicator of combined obstetrics and pediatrics care. Best indicator of combined obstetrics and pediatrics care. Best indicator of combined obstetrics and pediatrics care, guys. What is going to be your answer for this? Some indicator that includes the antenatal period, also the postpartum period. So what was the answer to this? No, not MMR. No. Combined obstetric is when the baby is in the womb, and pediatric means when the baby is out. So what is the answer over here? Here your answer is perinatal mortality rate. What was perinatal mortality rate? Death at 28 weeks gestation beyond or within first 7 days of delivery. Okay, I hope you remember this, everybody. Okay, chalo. Moving to the next one. Again a favorite of INI-CET exams, where they do ask you guys SAM. SAM ka definition पूछते हैं, SAM का example पूछते हैं. So this is our question number 3 for the day. Let's see how many questions we can target today, okay, in a couple of hours. So what is your answer? What is the one of the criteria used to define SAM according to WHO standards? Now if you see SAM child में 3 criteria होता है. Now look at the first one. Mid upper arm circumference more than, यहाँ पे ये गलत हो गया, right? Mid upper arm circumference has to be below 11.5 centimeters or 115 millimeters. ठीक है? Weight for age. Now we don't have to say weight for age. We have to consider, guys, low weight for height. And that has to be below -3 SD. ठीक है? Weight for height below -2 is wrong. It has to be -3. So one criteria is this one, the other one is this one, and also we can have presence of bilateral nutritional edema or pitting edema. ठीक है? SAM का 2 presentation also you should revise and go, guys. What were the presentation of SAM child? Kwashiorkor, it was Kwashiorkor and marasmus. So know the difference between the two. We have discussed in the videos. Kwashiorkor is more serious, everybody, but marasmus is more common from PSM point of view. Okay. Should we move to question number 4? Let's go to question number 4. Okay, question number 4. Again, a question which has been picked up from INI-CET. But let's see if I just wanted to revise a couple of facts. Today you'll see a lot of numericals, guys. Can you do this? Okay, so the question is... So the question, everybody, is, in a subcenter, CBR is 20, what is the minimum number of pregnancies registered with the ENM? You all know that ENM is the main person, multipurpose worker male, multipurpose worker female. Multipurpose worker female is the ENM. They are all posted in a subcenter. Now here what we have to do is, at any one point of time, okay, the number of pregnancies registered with ANM is 50% at any one point of time, okay. किसी भी एक समय पे आप देखोगे in a sub-center at least 50% of pregnancy should be registered with the ANM. So if you look over here, for 1000 population, the birth rate is 20. Now what is the population of a sub-center, guys? It is 5000 in plain area. Unless and until mentioned, we will consider plain area. So what is the birth rate that we are expecting, everybody? The birth rate that we are expecting is 110. So 110 I mean, 100. The births that we are expecting is 100. This is the expected pregnancies. But guys, there is one catch in this question. Will all the pregnant female give birth? There is not going to be any wastage. There will be wastage. So you have to always consider 10% of pregnancy wastage factor. आपको हमेशा 10% pregnancy wastage factor लेना है. So 10% of pregnancy wastage factor means we will calculate it from the expected pregnancies. So 10% of 100. How many pregnancy wastage are we expecting? 10. So now what is the number of expected pregnancies, guys? Number of expected pregnancies over here is always, you will add the pregnancy wastage factor. Whatever pregnancies we are expecting, 100 plus whatever wastage we are expecting, 10. So that becomes how many? That becomes 110. And at any one point of time, what has to be the number of pregnancies which is registered with the ANM? It has to be 50%. So at one point of time, how many pregnancies will be registered with the ANM, guys? 55. Clear? Point to be noted. Some students, by mistake, you might end up subtracting the pregnancy wastage factor. वो मत करना. It is always to be added. You will always have to add the pregnancy wastage factor. ठीक है? And remember, at any one point of time, 50% pregnancies are registered with the ANM. ठीक है? Thumbs up. I need some thumbs up in between so that I'm aware that you're getting, and anything that you want to ask or you don't get it, just make a note. I will definitely answer at the end of the session, okay? Let's go to one other question, guys. What is the correct sequence of steps in experimental study? Now, for INI-CET, these steps jo hote hai na, of case control, cohort, randomization, all these questions keep coming. So, this is a PYQ which has been picked up from past year papers. So, along with this question, I am going to revise the other questions also. So, what is the answer over here? Now, some of you have a confusion कि मैम पहले blinding है या पहले randomization है. सबसे पहले, like, what is it first? Is it blinding or is it randomization? Please remember, randomization is a way that eliminates selection bias. Okay. By ensuring comparability. So, first you select your population, you randomize, and then blinding follows. Alright, so over here, what have you marked your answers? First, we will be defining inclusion-exclusion criteria, then randomization, then blinding, then statistical analysis. So, यहाँ पे answer A है. ठीक है? Blinding is like, randomization is ensuring that blinding. Do you remember? Randomization means every participant gets an equal and known chance of being allocated either into the experiment group or into the treatment group. ठीक है? This randomization eliminates, what does it eliminate, guys? It eliminates selection bias. Once it eliminates selection bias by ensuring comparability. By ensuring comparability. So, this is where we have already achieved blinding. Okay, we've already done. Randomization is a way by which we are achieving that. Okay? Also, randomization, also guys, randomization eliminates unknown and known confounders both. Unknown and known confounders both. It also eliminates unknown and known confounders both. ठीक है? So that's the steps of RCT. I have also put out the steps of case control and cohort for you, because they might end up asking you that. So remember, case control mein select cases and control. Matching is the buzzword for a case control study. Matching eliminates only known confounders. Matching eliminates only the known confounders. Measure exposure, it's always going from effect to cause. But in cohort, look at the buzzword follow-up. Analysis is relative risk, attributable risk, PAR. We will be dealing questions with all of them. Yahan pe it is odds ratio. Okay, let's move ahead to one more expected question from INI-CET. Identify the number of risk factors. Now, I just wanted to tell you the interpretation of this graph where you're going to identify the number of risk factors. So, can anyone, does anyone remember how we do it, or do you remember the way, do you remember the approach, what we have to look over here? Okay, so now what is it that you have to what is it that you have to look over here? Sabse pehle guys, this is a, what is the name of this image? This is a forest plot. This is a forest plot, and a forest plot, everyone, is drawn only for a meta-analysis. It is drawn only for a meta-analysis. Forest plot gives us that one single effect, one pooled effect, one single value. That pooled effect or that value, guys, that pooled effect or that value is given by this rhombus, okay, or the diamond that you can see. The pooled effect is given by the rhombus or the diamond that you can see. So, how do we interpret? Now, all you need to do is, you will look at the interval. Now, if you look at the interval, it is 0.5 say 2.6. Now, what is the law? Look at the interval, okay, look at interval, look at the confidence interval. If it includes 1, agar interval mein 1 aa gaya, if it includes 1, it is non-significant. It is non-significant. But if it does not include 1, if it does not include 1, then what does it mean, everybody? It is significant. Agar wo 1 nahi include karega, it is significant. Now the value could be more than 1 or it could be less than 1. If it is more than 1, it is a risk factor. If it is less than 1, everyone, it is a protective factor. It is a protective factor. I hope you remember. So now look at the first one. 0.5 to 2.6. Of course, 1 is included. 0.5, 0.6, 0.7, 0.8, 0.9, 1. So this is not significant. And you can look at this also, it's far away from the average. If you look at the second one, 1 to 3.4, again 1 is not, again what is happening, 1 is included, 1 aa gaya, so not significant. 0.9 to 3.2, again you can see 1 is included, so this again is non-significant. But look at the last two, 1.9 to 2.7. Now do you see 1 in the interval 1.9 to 2.7? 1 is not included, 1 not included, 1 is not included here. So if 1 is not included, guys, it is significant. Now, if it is significant, it could be a risk factor also, it could be a protective factor also. So, to know for the risk factor, you will have to look at this value. Now, it is 2.3. That means it is more than 1. That means it is risk factor. Similarly, for this one, if you look at the interval 1.8 to 2.5, 1 is not included, so it is significant. But over here, look at 2.1, it is more than 1, so it is a risk factor. So, how many risk factors can you identify from this, guys? 2 risk factors. And if anybody asks you, what is the overall effect of the risk factors, guys? What is the overall effect of the risk factors? Then you will have to look at the rhombus. Am I clear? Moral of the story, look at the CI. If it includes 1, it is not significant. If it does not include 1, it is significant. Then you have to look at whether the value is more than 1 or less than 1. More than 1 is a risk factor, less than 1 is a protective factor. Now let me just give you this one, 0.3, 0.4 to 0.9. What is this? Is it significant or not? Can anyone tell me? 0.3 दिया हुआ है, and I have given 0.4 to 0.9. I have given 0.3 and the range that I have given is 0.4 to 0.9. Now, is this significant? So, if you look at the interval, very good Dhanush. If you look at the interval there, 0.4 to 0.9, one is not included. So, this definitely is significant. And then you have to look at this value of 0.3. Definitely that value of 0.3, everybody, is less than 1. So, is it a risk factor? No, it is a protective factor. This one is a protective factor. Clear? This one is a protective factor. ये आ सकता है guys. And अगर आपको बोला जाए, if they ask you that please tell me the overall effect of risk factor. So for overall effect of risk factor, you're going to look at this rhombus. Done. Forest plot. चलो. At the end, if we have time, I will also tell you once quickly the interpretation of funnel plot. Okay? Let's go to the next question. Which one is this? This is our PYQ only of INI-CET. They are fond of asking about entomology. So, water from a stagnant drain is collected in a container and observed for breeding mosquitoes. The image of the larva is shown below. Identify the species. Image of the larva. Is it Aedes? Is it Culex? Is it Anopheles? Is it none of the above? Guys. Let me show you. Something which rests parallel to the water surface. Stagnant drain. That's dirty. Okay, now if something rests parallel to the water surface like this one is Anopheles, but over here you can very well see this. Now what is this? This, everyone, is a siphon tube. Immediately most of you went on writing Anopheles. No. This is a siphon tube or a breathing tube, and this siphon tube, guys, is longer. It's not shorter. If it was a shorter siphon tube, it would have been Aedes. If it was a shorter siphon tube. If it was a shorter siphon tube, guys, it would have been Aedes. But here, it's a longer siphon tube. So, what is my answer over here? My answer over here is Culex. It's a longer siphon tube. Longer siphon tube means it is Culex. Clear? Everybody, so I have certain images for you also. If you look, guys, this is Anopheles. Anopheles has no siphon tube. But if you look at this one, यहाँ पे बहुत छोटा सा है. The smaller siphon tube, guys, is Aedes. The smaller siphon tube is Aedes. And if you look at this one, it's longer. So the longer siphon tube is Culex. Clear? Okay, moving ahead. Let's look at this question. A numerical again came in the last exam also. Anopheles has no siphon tube. Okay? Now, what's your answer to this one, guys? Can anyone tell me? Dependency ratio calculate karo. What was the formula of dependency ratio now? You know that dependency ratio numerator is not a part of denominator. Haven't got yet any answer. Dependency ratio क्या होता है? What is dependency ratio, guys? So I got the first answer. Okay, Dr. Pen is writing option C. Anybody else, guys? Dependency ratio means children below 14 years or up to 14 years, okay, are plus elderly beyond 65 years are dependent on the working class or economically productive age group 15 to 64 years. Okay, children below 14 years and elderly beyond 65 years are dependent on the working class, which is 15 to 64. Now here it was given to you, a region has population of 6,000 below 15 years, 12,000 between ages of 15 and 65 and 2,000 over 65 years. So children below 15 years is 6,000. Elderly over 65 years is 2,000 and over here you will have 12,000. So that is 8 by 12. So very well you can solve it and your answer will come out to be 0.66. Just you have to put in the numerator the value children below 15 years and elderly above 65 years, they are dependent on the working class. Is it clear? Will you be able to do this dependency ratio calculation? They do ask you. Okay, now let's solve a question on one of the programs which is favorite of examiners. Can you tell me this one? And there is an update also in the classification of paucibacillary and multibacillary leprosy. So we will discuss that. Tell me the answer to this. To start MDT, which of the following criteria has to be fulfilled, guys? Batao. Multi-drug therapy is for leprosy. So what do you have to fulfill? Hypopigmented patch with sensory loss, peripheral nerve thickening with sensory loss, skin biopsy demonstrating bacilli. The simple point, see, leprosy is one of the favorite programs for INI-CET, NEET, PG, FMG, all the exams. Questions do turn up from this one. So now there's also been a classification chain, PBL and MBL. Now you all know that definitive, what do I mean by hypopigmented patch with sensory loss? It means definitive loss of sensation in the hypopigmented patch. Okay, there's thickening or enlargement of the nerves. Now some of you are writing C, some of you are writing B. So over here, guys, to start MDT, you can start MDT based on two criteria, which is hypopigmented patch with sensory loss and peripheral nerve thickening with sensory loss. This one and this one. You can start MDT based on these two criteria. You don't really need to wait for the skin biopsy demonstrating bacilli. We can start to initiate MDT. Which of the following criteria should be fulfilled? Okay, to start we can do. For classification, of course, we have to look at the skin biopsy also. But MDT start करने के लिए enough है skin lesion involvement, at the same time nerve involvement. Now, can anyone tell me which is the most common nerve involved in leprosy? You all know ulnar nerve. And what happens in the nerve involvement? Thickening or enlarged हो जाते हैं nerves, or it also results in loss of sensation to the muscles being supplied. Okay? Now I just wanted to discuss one thing. I hope you remember PBL and MBL, guys. Okay, I hope you remember two classification. There is PBL, there is multibacillary leprosy. Now in terms of skin lesions, in terms of nerve involvement, we will classify in terms of skin biopsy, skin smear examination. Alright, skin smear examination. Now, paucibacillary leprosy is 1 to 5 lesions, multibacillary more than 5 lesions. Nerve involvement में paucibacillary क्या है? No nerve involved, no nerve. Multibacillary more than equal to 1 nerve involved. After that, skin smear examination में negative at all sides, negative at all sides. That if you talk about multibacillary leprosy, positive at one or more sites, positive at one or more sites. And what about the drugs now? What about the drugs? So in both the leprosy, it's a 3-drug regime. It's a 3-drug regimen. The duration of treatment, guys. What is the duration of treatment? The duration of treatment, if anybody asks you, for paucibacillary, 6 to 9 months, and for multibacillary, 12 to 18 months. If you remember this, ठीक है? Yes, Chaitanya. कोई भी nerve involvement is multibacillary leprosy. Is it clear, everyone? Is it clear? This is important. This is, yeah, we will be revising health programs. What's your good name, dear? Indra, we will be revising health programs, like we've picked up the first one, leprosy. In between, I will give you question for TB. In between, I also have question for NCD. So don't worry, we will be revising that. Is it clear? And what are the 3 drugs? Dapsone, rifampicin, clofazimine. Which one is given as monthly supervised doses? It's only rifampicin. Thumbs up, everyone. Classification of leprosy. To start MDT, we would require the 2 drugs. Now, I hope you all would be able to answer this question. Chalo. The following campaign depicted in the image was launched to spread awareness about which of the following? Great, Akash. You can even attend this session, even though it's INI-CET, but you're most welcome. the questions are kind of circulating in all the exams, guys. The topics never change. So jahan se bhi you can get to solve MCQs, kar lo wahan se solve. ठीक है? Okay, what is this? Now. Be careful, everybody. That's why I've given you this question. Most of you are coming up with the answer Sapna. Sapna is with the school bag. Sapna is with the school bag. Here you can see a pretty little girl who is like kind of running, and there's like a parrot behind her, because nobody is stopping her. Just to remember it this way, all her rights are being given to her. This is an image of everybody, child's right. This is an image of the girl over here shown as Meena. Meena, fatafat se leprosy mark mat karna. I'll show you the image of Sapna also. Okay, Sapna is with the school bag. So Meena ka concept, guys, was given by UNICEF, and it was to promote child's right. For leprosy, it was a very successful initiative. For leprosy, this is the girl. For leprosy, this is the girl, Sapna. Now, Sapna, guys, was a cured case of leprosy. She was a cured case of leprosy, and under the Sparsh initiative, एक initiative था, guys, Sparsh initiative. So, under the Sparsh initiative, we used the Sapna mascot. Sapna mascot को यूज किया गया टू स्प्रेड अवेयरनेस ऑन लेप्रेसी. ओके, टू स्प्रेड अवेयरनेस ऑन leprosy. Is it clear? So how can you remember this? Sapna is with the school bag. Meena is because she's flying. Nobody is like stopping her. One fine day, if I tell my daughter, today I'll not stop you from doing anything. Watch TV, eat food that you like. So what will happen? She'll be so happy. She'll fly in the air. So just remember, I'm not stopping her from any of her rights. So Meena is for child's right, everybody, and Sapna is for leprosy. Clear? Chalo, let's go to the next question, guys. Okay, so here I'm going to draw an image. I'm so sorry, I missed on the image. So I'm going to draw an image for all of you. Just give me one moment. I'm going to draw the image, guys. This is your image. Identify the statement regarding, true statement regarding box and whisker plot. Javed, we will take up this, dear, don't worry. Abhi hum log iske, like, let's me wrap up this session. We have couple of more questions. We'll take 1.5 hours to wrap up the session. Then of course I'm going to take up any query, anything that's troubling you. I'm always there to help you. We are here, so we'll talk about it. Now guys, what is this? This, you know, is a box and whisker plot. So interpretation of box and whisker plot is a very, very favorite question of INI-CET exams. If you pick up your PYQs, 2-3 times आया हुआ है. So let's do it. Number 1, you can get an image like this. Okay, you can get an image like this. Now if you look at a box and whisker plot, beach में the central one is the box and the tails. Okay, now these box represents quartiles. What are quartiles? Measures of position. Quartile क्या होता है? हमारे, like in biostats, you have measures of central tendency, which are mean, median, mode. You have measures of dispersion, which is like range, standard deviation, standard errors, coefficient of variation, variance. You also have measures of location or position, जो होता है जैसे quartile, pentile, centile. Okay, so over here a box and whisker plot represents quartile. Quartile divides the box. This is the median. Median, if you see, equal gap on either side. Okay, this means it is a normal distribution curve. ठीक है, normal distribution curve. This is a normal distribution curve. But in case in the exam you get an image like this. Now where can you see the gap more? Where is the gap more, guys? It's more on the right hand side. So this is which side skewness? This is a skewed observation. Gap is more on the right side. So this is right sided skewness. Okay, so first we have to look at the box. Now suppose you see, look at this point very carefully. You see that the box is equal but the tail is elongated on one side. After the box, you look at the tail also. Box mein distribution is equal, but the tail is elongated on one side. So here the tail is elongated on the left side. So what does this become? It becomes the left-sided skewness. First, look at the box. Wherever the gap is more, it's that sided skewness. After that, look at the tail. But in the exam, what did they give you? They gave you a vertical image. So what are you going to do if they give you a vertical image? Don't worry or anything. Just rotate it clockwise. Okay? Just rotate it clockwise. Now, if you rotate this image clockwise, everybody, what will you see? If you rotate this image clockwise, isko aap clockwise rotate karo. So if you rotate the image clockwise, you will see that over here, where is the gap coming more? It's coming more, everybody, on the, which side is the gap coming more, everyone? It's coming more on the right side. So which sided skewness it is? It is a right sided skewness. You just have to rotate it. Rotate karke you can see the gap is more on the right side. This side, the gap is more. So this is what? A right-sided skewness. The tail is also prolonged on the right side. And for right-sided skewness, we know what is the value, guys? Mean is more than median is more than mode. So this is your answer. Did you all understand this? Or should I repeat it once again, everybody? Whenever you get a box and whisker plot, you will look at the box. If you see equal distribution on either side of the median, it is normal distribution. But whichever side the gap is more, it's that sided skewness. If you, after the box, look at the tail also. If you get a vertical image, rotate it clockwise. Once you rotate it clockwise, you see that agar ye median hai, gap kis side zyada aa raha hai? Where do you see the gap is more? You can see it's more on the right side. So this becomes a right-sided skewness or positively skewed data. And we all know for a right-sided skewness, mean is more than median is more than mode. Thumbs up everyone in the class. Everyone in the class. I want a thumbs up so that I am happy, and I know that if we get this question in the exam, all those who are looking at this right now or later will not make a mistake. Give me a thumbs up, everybody. Then I'm going to proceed to the next question. Okay, chalo. So that's the interpretation of box and whisker plot. Okay, let's go to the next one. Again, a patent MCQ. Test of statistical significance. So I thought I am not going to kind of leave out any topic from biostats which keep coming in INI-CET for your revision. Okay, because biostat aana hai. Last time 4 questions from biostat were only there. लेफ्ट साइड में कुछ नहीं देखो डॉक्टर आकाश अगर इमेज इफ द इमेज डियर was like this, okay, if the image was like this. Now when you rotate this clockwise, Akash, just guys 1 second, okay, I'll just tell one more time. If you rotate this clockwise, Akash, just imagine rotating it clockwise. How would your image come out to be? Like this. So now where is the cap more? The cap more is on the left side here. So for left side, if the gap is more, it will become left-sided skewness. So mean is less than, median is less than mode. Clear? Manoj, Akash, everybody, those who are asking, Dr. Manoj, Dr. Akash, sab samajh gaya na? Chalo. If you've still not got it, you can ask me at the end also. Alright, now let's go to this question. What have you answered over here? So this is test of statistical significance. Whenever you get a question on test of statistical significance, you should know the approach, guys. क्या पता होना आपको? Approach. Now what is the approach? First thing that you have to know is whether I will be talking about a parametric or a non-parametric. So what is the approach? To decide whether you will be using a para or a non-para, you have to look at the variable. Is it quantitative or is it qualitative? Now remember one thing, if you have quantitative variable, how do you know it is a quantitative variable? What is the difference between a quantitative and qualitative? Quantitative variable is measurable. When I say it is measurable, it means it has a unit, guys. Like, अच्छे से समझो इस topic को, no rush. Suppose I say weight. Weight has a unit, you can measure weight. Height is a unit, you can measure height. Hemoglobin has a unit, you can measure height. But on the other hand, if I say a qualitative variable, let's say I say gender. Does gender have a unit? No. Qualitative variable is countable. You can't measure them. आप उसको काउंट कर सकते हो, like 10 boys in the class, 3 girls in the class, that's countable, you can't measure it. But if I say religion, again religion ko you can count. 20 people belong to religion X, 13 people belong to religion Y. I can't measure religion. So all you have to do is any disease, if I say, do you have hypertension? Your answer is yes ma'am, no ma'am. So hypertension I can count how many people have hypertension. I can't measure hypertension. But if I say blood pressure, what is blood pressure? Tell me in the comment section. Will blood pressure be quantitative or qualitative? Blood pressure क्या है? Blood pressure is something which has a unit. I can measure blood pressure. mmHg. I can compare blood pressure. So blood pressure is a quantitative data. If I ask you guys anemia, anemia क्या है? Anemia is qualitative. You can count the number of people who are anemic, but you can't measure anemia. Can you measure anemia? No. You can measure hemoglobin because hemoglobin has a unit. Okay? So moral of the story is, one second, moral of the story is whenever you get a variable, the first thing that you have to see is it quantitative, qualitative? Quantitative you can measure in a unit. Qualitative you cannot measure. After that, if you figured out what it is, quantitative, qualitative. Quantitative will have a parametric test, qualitative non-parametric. Now which test? So for that you look at the groups. If it is one group, two group or more than two group, as simple as that. Now look over here. Study is done on a group of children to check SIDS in summer season from June to July and from August to September in another group with similar characteristics from this area. Which test should we use? Now you tell me, what are you going to write over here? Now here, number one, you're looking for SIDS. Now SIDS is quantitative or qualitative? In the comment section, everyone in the class, SIDS. SIDS is a disease, sudden infant death syndrome. So will you include it as quantitative or qualitative? You can't measure SIDS. You can count the number of children who became a victim of SIDS. So SIDS kya hai? It's like a disease. So SIDS, everybody, is a qualitative variable. Now when I have a qualitative variable, I have to use which test, everybody? I will use a non-parametric test. After this, you're going to figure out how many groups are there. Now if you see, I am looking at distribution of SIDS once in summer season from June to July, that is one group, and once from August to September, that is other group. So how many groups do we have over here? We have two groups, and for any qualitative variable, when you have to see, when you have to compare two or more than two groups, what is the variable that, what is the test that I'm going to use, everybody? I'm going to use a chi-square test. समझ में आया? Moral of the story, never rush in such questions. First see, is it quantitative variable? Is it qualitative? How will you know it is quantitative and how will you know it is qualitative? All you need to do is ask yourself, does this variable have a unit? If your answer is yes, which I'm definite you'll be able to figure out, blood pressure, hemoglobin, height, weight, all of these have a unit, it is quantitative. If it is not having a unit, but you can just count like gender, religion, blood group, disease, it is qualitative. Now if it is quantitative, you will take up parametric. If you have one group before and after intervention, compare hemoglobin before drinking, after drinking in a group of alcoholics. So that is what? One group, paired t-test. If you have to compare in two groups, that is unpaired. More than two groups, ANOVA. For non-parametric, two or more than two groups is always chi-square. समझ में आया सबको? Is that clear, everybody? Okay. At the end, if I have time, I will give you some random datas, variables, and I will ask you what are you going to use over here, para or non-para. Also remember, parametric test is associated with alphabets, t-test, ANOVA, and non-parametric is with all fancy names, Wilcoxon sign rank, McNemar, Mann-Whitney, Kruskal-Wallis. तो कोई fancy name दिखा, it's a non-parametric test. Okay? चलो, proceeding to the next one, pneumonia management. Let's see if you can solve this, guys. Take your time, read out the question. No rush at all. Let's solve this question. What are you going to answer? Pneumonia is again asked in INI-CET. NEET PG भी पूछ लेता है, FMG exam भी पूछ लेता है. So let's see. What's your answer? A 15-month-old child was brought to the hospital with a history of breathlessness, fever, cold and cough. On examination, the respiratory rate was 47 per minute and there was no chest indrawing. What is the correct management? Now remember, if nothing is written, we have two types of managements. ठीक है? अगर कुछ नहीं लिखा है, we will consider IMNCI. In case they mention SARS program, that's an initiative of the government, then we will go according to SARS program. The only difference is in SARS program, chest indrawing is taken as severe pneumonia. Okay. Now here what we have to do is, first we have to look at the age group. Okay, so here it is 15 months. Okay, here it is 15 months. Can you just give me one moment? Those who have not done, just try to solve it. Just give me 1 second, guys. So sorry. 1 second दे दो. Okay, yeah, let's continue. So the first thing that you're going to look over here is the age group. Now, when we have to, let me show you in a clean slide how we do IMNCI management. So IMNCI management, integrated management of neonatal childhood illness. So here you have to divide into up to 2-month-old baby and यहाँ पे हो गया 2-month to 5-year-old baby. So first thing you have to look at the age group. Next, if the baby has nothing, no chest in drawing, no chest in drawing, also no chest in drawing and no fast breathing, FB, no fast breathing, कोई tension नहीं है. This is a case of no pneumonia, alright, no pneumonia. And in which color are you going to manage according to IMNCI? It's a color coded management. So these both will go in green color and green color means home management. What does green color mean by, guys? Green color means home management. फिर आता है the second situation. You have to look, is chest in drawing present? Chest in drawing तो नहीं है. I hope from pediatrics you know practically how to assess chest in drawing. Okay, so chest in drawing and or fast breathing. दोनों है और either one. Now up to 2 months, this is a danger signs, guys. 2 months old baby is a danger, and if he has chest and drawing or fast breathing, I am going to club it in severe pneumonia. But if I have a 2-month to 5-year-old baby, I will just say pneumonia. Okay, I will just put it as pneumonia. Now if I have severe pneumonia over here, ये बच्चा किस कलर में जाएगा? This baby is going to be managed pink color. Pink zone means you will keep the baby warm, you will give the first dose of antibiotics, avoid, we can work with, if the baby is taking oral antibiotics, well and good. So we'll give syrup amox and refer where to CHC. Why to CHC? Because there a pediatrician is posted in a CHC. But 2 months to 5 years, because you know up to 2 months is a danger sign in a baby. So we've put it as severe pneumonia. But then if you have a 2-month to 5-year-old with pneumonia, इसको आप डालोगे yellow color में. Which color management am I going to put this into? This baby into yellow zone. Now what is this yellow zone? I'm going to put him in yellow. Yellow zone में we don't have to send it to CHC. Just give him syrup antibiotic, syrup amox has to be given, and this is OPD treatment. Okay, and refer back, return home, return to follow up in 2 days. Return to follow up in 2 days. You have to send him home and the baby should come with the mother in 2 days. But the last condition, if the baby has any danger signs, guys, if the baby has any danger signs, name a couple of danger signs in a baby. I told you one to hai age group up to 2 months. Other than that, lethargy, very danger. Agar bachcha irritable hai, that's okay. Lethargic baby, like in kwashiorkor, baby is lethargic. Marasmus, the baby is irritable. Okay, So lethargy, stridor in a calm child, cyanosed baby, convulsions, very high fever, not breastfeeding, all these are danger signs. Okay? So up to 2 months we are going to put him in very severe pneumonia. We will put the baby in very severe pneumonia. ठीक है, and on the 2 months to 5-year-old we will club the baby in severe pneumonia. In both the situations, which color am I putting the baby into, guys? I am putting into pink. So when it is pink, where are you going to refer, everybody? Give syrup amox and refer to a CHC. Am I clear, everybody? This is according to IMNCI. Up to 2 months mein chest and drawing is taken as severe pneumonia. So see, what you have to do is, no bache, the first thing you have to assess is the age group. Accordingly, the classification is affected. So you will have to do your management. Let's go to the question. What is written in the question? 15-month-old. So if I have a 15-month-old baby, which classification am I going to follow? I am going to follow this one. 2 months to 5 years. And in 2 months to 5 years, I have no pneumonia, pneumonia and severe pneumonia. पहले आप ये याद करोगे, ठीक है? फिर देखो. So then, history of breathlessness, fever, cold and cough. On examination, respiratory rate was 47 and there was no chest and drawing. Chest and drawing nahi hai. But now, yeah, one more thing. How do you assess fast breathing, guys? What is the rule to assess fast breathing? I hope you all know. There is a rule of 60, 50 and 40. Now, what is this rule? Up to 2 months old, if respiratory rate is more than 60 per minute, it is fast breathing. 2 months to 12 months. 2 months to 12 months. If it is more than 50, guys, per minute, it is fast breathing. And what about 1 to 5 years, everybody? If respiratory rate is more than 40 per minute, guys, it is fast breathing. अब यहाँ पे देखो, the baby is 15 months and the respiratory rate is more than 40. So, of course, the baby is a victim of fast breathing. So, only there are no other danger signs mentioned. Always look at the weight also. Weight of the baby has not been given. If the weight is low, then we will consider as a severe case. But यहाँ पे only fast breathing, no other danger signs. So, the baby is suffering from what? Pneumonia. So, what are you going to do? You will put in yellow zone, give the baby oral antibiotics, syrup amox you can give. Tell the mother about the danger signs, what are the danger signs, and return to follow up in 2 days. Is it clear, everybody? Did you understand pneumonia management? Because pneumonia management turns up in the exam. ठीक है, thumbs up. Can we move ahead, everybody? Anyone who's still having a doubt? More than equal to 60, yeah, that is okay. More than 50, more than equal to 40, that's okay. All right, so let's move forward. Chale? Okay, one PYQ I just wanted to pick up from your past year paper. Kabhi INI-CET is fond of asking certain acts and they can just be repeated. So, we'll just go through this and talk about it in one go only. There are a few declarations: Geneva, Oslo, Tokyo, Helsinki. Okay, this is important for INI. Now, they can just pick up a single definition this time and ask you to match it. So, you know, Geneva Declaration is what? Very good. Geneva Declarations is physician's declaration to the humanitarian goals of medicine. What about Oslo? Oslo meant for some statement on therapeutic abortion. What about Tokyo? Tokyo guideline or declaration was a guideline for physicians concerning torture and other inhuman degrading treatment or punishment in relation to detainment or imprisonment. Helsinki, guys, Helsinki, everybody, is set of ethical principles directed to medical community for human experimentation. Next time they can give you this as separate, like they can just ask you what is Geneva Declaration, what is Helsinki, what is Oslo, क्योंकि कुछ ना कुछ ऐसा 1 out of the 10 or 12 or 15 questions in PSM will be this one. Okay, moving to the next one. Again, a favorite of INI-CET exam, the calculation of absolute risk reductions and number needed to treat. Absolute risk reduction and number needed to treat, everybody, less chance of coming in FMG exams, but can come for INI-CET. And if they want to trouble, of course, then we can get it in NEET PG and FMG exams also. Let's see this. What is this? In a clinical trial involving 200 patients, the treatment group experienced 20 events while the control group had 40 events. What are the absolute risk reduction and the number needed to treat? Now I just wanted to revise the formulas over here, so I've brought this calculation, everybody. Absolute risk reduction. What is the formula? The formula is event rate in control group minus event rate in experimental group. Event rate in control group minus event rate in control group. So CER, to be clear, is event rate in control group. Event rate in control group. Now if you see over here, how many people, what is the control group? Control group is 100. How many people had the event? 40. So what is the event rate in control group? 40 by 100. What about experimental group? EER. Event rate in experimental group, guys. So the event rate in experimental group, everybody, is going to be, how many people were that had the treatment? Everyone? 100. Out of them, how many experienced the event? 20. So now what is absolute risk reduction? Absolute risk reduction is nothing but 40 by 100 minus 20 by 100. So that is what? 20 by 100 into 100%. You will also get it. Absolute risk reduction that you can do is this one. Is it clear, everyone? So you can calculate over here. You will get the answer over here, 20% into 100 kar do. So this will come 20%. But now what is number needed to treat? This is absolute risk reduction. Now what is number needed to treat? NNT is nothing but 1 upon absolute risk reduction. So this is 1 upon 20 by 100 or 100 by 20, which is equal to 5. So you need to treat 5 patients to prevent harmful infect in one another. So what is the correct answer over here? Option A. Did you understand, everybody? Absolute risk reduction is control group event rate minus experimental group. You can very well do this without pen and paper also. You just have to see how many people are on control group, what is the event happening in them, how many are on experimental group, what is the event happening, and then do this difference. Number needed to treat is 1 upon absolute risk reduction. Now one more thing, अगर कोई आपसे पूछ लिया relative risk reduction, anybody in the class can give me a formula for this. What is relative risk reduction? Can you tell me the formula for this? Relative risk reduction. Relative risk reduction, what is it? So that is nothing but control group event rate minus experimental group event rate divided by control group event rate. It's relative, so we have to have a denominator. Okay, can I move to the next question? Yes, Uma, we are right now covering a lot of questions. So particularly whatever comes in INI-CET, like these conceptual steps, they are very importantly asked in INI-CET only. This absolute and this box and whisker plot. So all that we are covering, everybody. Okay? Okay. Let's move ahead. What's the next question? Can anyone answer this? Can you all see me? Okay, now I think it's fine. Is this okay, guys? Okay, alright, chalo. What is the answer? Which of the following duties are performed by male multipurpose worker? Now, if I talk about male multipurpose worker, he is posted in a sub-center. He has 3 most important duty, which is collect sputum sample. What have you written? All of you are writing C. Some of you are, what is C? Collect sputum sample, distribute ORS, malaria surveillance. So, it is 2, 3 and 4. Okay, so now what is the answer over here? 2, 3 and 4. So for male multi-purpose worker, guys, collect sputum sample, active malaria surveillance, prepare malarial slides. So active malaria surveillance. Also one more is chlorination. This is exclusive for multi-purpose worker male, guys. ठीक है. What about multi-purpose worker female? Eligible couple register or family planning register. This is multi-purpose worker female or ANM. Perform hemoglobin urine testing, ANM. ठीक है. And one more thing, distributing ORS, giving vaccines, distributing contraceptives, any of them can do, but you need to know the exclusive functions. Inserting copper device, IUCD, that is only a work of multi-purpose worker female. Okay, let's go to one more numerical. Today I'm going to flood you with numericals because now they have started asking a lot of things on numericals. So I thought I won't leave out particularly the numerical practice. So what is the answer over here? A community has total population of 10,000. Children of age group 0 to 6 years are 2,000. Literate individuals above 7 years of age are 4,000. What is effective literacy rate? Now earlier whom would we call a literate? Anybody who could read and write with understanding in any one language, okay? But now we have something known as effective literacy rate. So for effective literacy rate, guys, what is it? The number of literates. In this we now, literates, now in this we have to consider the age group. Alright, so it is population above 7 years. This you cannot forget. The age cutoff. To be called as literate, the age cutoff is 7 and above. And although I say it as rate, guys, it is actually a proportion. Numerator is part of denominator and the multiplier is 100. So it is actually a proportion. So what is the number of literates over here? Total population is 10,000. 0 to 6 is 2,000. Literate people are 4,000. But what is the population beyond 7 years? From this total, you will have to subtract 0 to 6 years, which is 2,000 into 100. Don't multiply it with 1,000 because although I say it a rate, literacy rate is always given in percentage. So multiplier is 100. So this is 4,000 upon 8,000 into 100. So very well your answer comes out to be 50%. Okay, effective literacy rate. If it was written crude literacy rate, for crude literacy rate you don't actually consider the age group. Got it? Great. Read this question, everybody. Read this question and try to tell me the answer to this one. A couple of definitions which could be put in the form of a question. What is your answer here? So the question says, 5-year-old Ram and 3-year-old Sham are Ramadevi's son. Sham developed a rash but Ramadevi ignored it, assuming it to be an allergy. After 10 days, guys, Ram also developed a rash along with the fever. Out of fear, Ramadevi took Ram to the PHC. The healthcare workers at PHC suspected it to be measles. Choose the correct option. Now you all know what is a primary case. Primary case hota hai the first case introduced into the population. And what is an index case, guys? Index case is the first case to come to the notice of an investigator. Now over here, who was the first one to be affected? First one was affected was Sham. Okay, so Sham ko Ramadevi ignored ki and brought Ram to the clinic. So what is Ram, everybody? Ram is an index case. Yes or no? After 10 days, Ram developed a rash. Out of this, Ramadevi took Ram to the PHC. So who is the first child who was brought to the notice of the investigator? Ram. Ram was the first one who was brought to the notice of the investigator. Okay, but who is the first one who developed the rash? Sham. Sham was the first one. Sham was the first one to develop the rash. Now, in between, if they had added that some Karan and Arjun also came to visit their house and they developed the rash too. So, Karan and Arjun kya ho jate? Karan and Arjun would have become the secondary cases. Secondary cases are cases that develop disease following exposure to a primary case. Are you understanding? Now, Ram got the infection from Sham. Is it clear? Of course, Ram got the infection. Ram got the infection from Sham. Ram could have received post-exposure prophylaxis if his mother had brought him to the hospital when Sham got the rash. Now, over here, Sham developed a rash and Ramadevi ignored it. Okay? So, Ram, if she had brought Sham to the hospital, Ram could have been saved. Yes or no? Why? How could you have saved Ram, everybody? How could you have saved Ram? So, just read this. Susceptible contacts over age of 9 to 12 months may be protected against measles with the measles vaccine, provided it is given within 3 days of exposure. So, if Ramadevi had brought Sham to the hospital, we would have known that Ram uska bhai hai and we could have saved Ram by giving him a shot of vaccine. But I hope you all know within 3 days, because incubation period of measles is 10 to 14 days and post vaccination it is 7 to 10 days. So, if you want to get the advantage of vaccine, it should be given within 3 days of exposure. Measles can also be prevented by giving immunoglobulin early in incubation period. Dose could be asked 0.25 ml within 3 to 4 days of exposure. But if we have to make a choice between vaccine and immunoglobulin, we will go for vaccine. And in case immunoglobulin is given first, then the vaccine should be given 8 to 12 weeks later. This again is a PYQ. Clear? Everybody, did you understand this? So, all these definitions that are there, they could be asked in the form of a conceptual question. Okay. Let's move ahead. Can you do the calculation again? Let's do one more calculation for the day. Everybody, let's solve one more calculation for the day. In a foodborne outbreak investigation, 40 out of 50 individuals who ate potato salad developed illness, while 5 out of 150 non-eaters were affected. Calculate relative risk and attributable risk. Now, everybody, what is relative risk? Relative risk kya hota hai? You all know relative risk is also known as risk ratio. And this, guys, is calculated from a cohort study. In a cohort, we calculate incidence. So, what is this? This is nothing but incidence among exposed divided by incidence among non-exposed. Incidence among exposed divided by incidence among non-exposed. Now, if you see over here, how many people are exposed? How many people ate potato salad? 50. Out of them, how many developed the disease? 40. And how many did not eat? 150. Out of them, how many developed the disease, guys? 5. So, what is going to be the relative risk in this case? What is the relative risk if you calculate 40 by 50 by 5 by 150? So, if you calculate, what did your answer come? Very good, 24. Your answer will come 24. Yes, your answer will come 24. And over here, attributable risk, so all you have to do is, you have to put the formula, guys. Attributable risk is incidence exposed minus incidence non-exposed divided by incidence exposed. So, even if you don't calculate this, आपको 24 already मिल चुका है. Attributable risk will come out to be 95.8. Is it clear? So, all you had to do was look at the formula. Relative risk is incidence exposed divided by non-exposed. Attributable risk is a risk difference, incidence exposed minus non-exposed. Clear? So, this formula definitely can come for you in the exams. Can we go to the next MCQ, everybody? Okay, alright, give me a thumbs up. Are you enjoying the session? I hope we can continue for some more time for 1 hour, 20-30 minutes. Yeah, everybody? Chalo. Now, look at this question. Look at this question. Look at this question. Again an INI-CET type of question. Okay, but then this is just a story. वो पूछ एक ही चीज रहे हैं, and whatever they are asking here, no, that could be asked in NEET PG exam also, FMG exam also. Why? Because they are asking a question on interpretation of p-value. What are they asking a question on? They are asking a question on interpretation of p-value. They are asking a question on interpretation of p-value. Now, what is this p-value ka interpretation, if you remember? What is this p-value? See, यहाँ पे what I have given you, which of the following statements accurately reflects the findings of multivariate analysis presented in the table? Forget about all this. We have certain variables. One is age. Look at the question carefully. One is gender, male, female. One is rural, urban, area of residence, and one is literate, illiterate. You have been given the odds ratio and you have been given the p-value. Now, before we actually go to the interpretation of the questions, you all know when is p-value significant, guys. P-value significant कब बोलते हैं? First of all, what is p-value? P-value is the probability of committing a type 1 error. We will also discuss type 1 and type 2 errors today. But p-value, if it is below 0.05, we know the results are what? We know the results are statistically significant. If the p-value is below 0.05, everybody, हमें पता है it is significant. So all we have to do is look at the p-values. So if you look at age less than 50 years, it is below 0.05, significant. 50 to 59 years, 0.001, significant. 60 to 69 years, 0.001, significant. Significant. That means age has a significant association. It is below 0.05. So if you see over here, have they given any statement? Risk of developing blindness increases with age. Absolutely correct. Because everywhere the p-value is below 0.05. Now look at male, female. What can you see over here? If you see male 0.02. So now over here if you see the male population, guys, 0.02. That means it is not significant. Chhod do. Okay, female population, if you see less than 0.001, it is significant. So is she at greater risk of developing blindness? No, it is protective of blindness over here. So again, this one is gone. If you look at rural areas, people dwelling in rural areas, rural 0.01. So again, this is not significant. Alright, but if you look at last one, illiteracy leads to an increased risk of developing this thing. Over here, female population, okay? So if you see illiteracy leads to an increased risk. So over here, if you see illiteracy again is significant. So what is this? Less than 0.05. So what is the answer over here? This one and this one. So आपका answer क्या हो गया? 3 and 4. Clear, everybody? Okay, all you need to do is you need to look at the p-value and accordingly assess. Can I go to the next question, everyone? Can I go to the next question? So just look at this, because see, some of you might have a doubt over here. First wala dekho, female population is at a greater risk. If you look at the odds ratio, what is the odds ratio for female population? 0.3, which is less than 1. So female population is significant and the value is less than 1. That means female population is protective. That is why statement number 1 is wrong. Did you understand, Indra? Guys, look at p-values. If p-value is less than 0.05, significant. After that, to know whether it's a risk factor or a protective factor, you'll have to look at the odds ratio. Now for age, everywhere the odds ratio is more than 1. So it is a risk factor. Okay? But female population, the odds ratio is less than 1. So for odds ratio is less than 1. So female population is the protective factor for blindness. Ab samajh mein aaya? So you have to look at the p-values and then you have to look at the value of odds ratio, whether they are more than 1 or they are equal to 1. Thumbs up everyone in the class. This is something you can expect in INI-CET. The interpretation of the values. Look at, like we discussed the forest plot interpretation, look at the interval. 1 था तो not significant. Similarly, look at p-value. Below 0.05, significant. It could be a risk factor also, it could be a protective factor also. Then you will look at odds ratio. If it is more than 1, it is risk factor. If it is less than 1, it is protective factor. Chale? Chalo. Okay. Let's have a look at this question, guys. A pregnant woman in the 3rd trimester having fever was diagnosed as a case of falciparum under NHP. Which drug is recommended? Now, this one is important for INI-CET also, NEET PG also, all the other exams. They do ask treatment of malaria. So, you have to know Plasmodium falciparum. The treatment is ACT, guys. If it is other states, it is ACT SP. I will also suggest you to go to the doses once and practice the doses. I mean, know the doses for important TB drugs, HIV drugs, malaria drugs, leprosy drugs. ये 4-5 disease के doses आपको पता होने चाहिए, whichever exam you are appearing for. And if it is northeastern state, it is ACT LM. Plus we add primer queen. Okay, this is the general, but here the question was 3rd trimester. So if the woman is Plasmodium falciparum and she is pregnancy. So in pregnancy, guys, we will take up the 1st trimester. In case they ask 1st trimester, your answer is quinine. But over here they are asking 2nd or 3rd trimester. 2nd or 3rd trimester, it is ACT. And the same thing, guys. Other states, if I say, it is ACT SP, and if I say northeastern state, it is ACT LM. But do I add primer queen? Never. So primer is contraindicated. Primer queen is contraindicated in pregnancy. That is why you will not say option B. What is your answer over here? Option A. But in case in the exam, if you see drug of choice for Plasmodium falciparum in pregnancy, suppose trimester is not mentioned. If the trimester is not mentioned, what is your answer? It is ACT. If trimester not mentioned, alright, if trimester not mentioned. If trimester is not mentioned, it is going to be ACT. ठीक है? Yes, it's also contraindicated in G6PD deficiency. Very good, Happy Soul. Such a wonderful name you have kept, Happy Soul. Okay, let's move ahead. Something from TB, some classification. Wanted to give you an update also here for some TB questions. What is this? A TB patient whose biological specimen is resistant to more than one first-line anti-TB drug other than both isoniazid and rifampicin is classified under programmatic management of diagnostic treatment guidelines as. What is the answer here, guys? Read. Other than isoniazid and rifampicin. So one correct answer I've got by AAAA someone. Guys, take your time, think again, no rush. क्या हो गया इस क्वेश्चन में? It's simply based on definitions, right? Now, if you have polydrug resistant, or let's start with MDR. MDR क्या होता है? MDR is resistant to H and R. Okay, what is polydrug? Resistant to two or more than two first line drugs, except which one? Except, guys, H and R. Because if somebody is resistant to isoniazid and rifa, they are MDR. So here it was clearly written other than H and R. So what is this case? This is a case of polydrug resistant. Yes or no? See, such are these questions. You might have missed out reading other than. That's how you can get tricked in exams. Okay, guys? So be very careful when you're reading the question. Or pre-XDR क्या होता है? Pre-XDR is somebody is MDR plus, that means resistant to isoniazid rifampicin, plus is resistant to any fluoroquinolone. any fluoroquinolone. Any fluoroquinolone means except levo and moxie. Except levo and moxie. And what is XTR, everybody? Extensive drug resistant. What is XTR? XTR is pre-XTR plus resistant to what? Plus resistant to any Group A drugs. Now, what are these Group A drugs? What are these Group A drugs? Group A drugs, I'm going to write it here. Group A drug. If I ask you, what is Group A drugs? So, the Group A drugs, guys, could be either levo, could be moxie, could be linezolid, could be bedaquiline. Could be bedaquiline. Okay, so these definitions we have to be very careful. And what is the treatment regimen of MDR? What is the update, guys? What is the treatment duration of MDR, everybody? The treatment duration of MDR is now 6 months. The treatment duration of multi-drug resistant TB is now 6 months, and I hope you know the latest regimen, guys. B-Pol-M regimen. Bedaquiline, pretomanid, linezolid, moxifloxacin. ठीक है? Poly drug resistant का regimen क्या है? 6-0. Now what was 6-0? 6-0 was 6 months of Z stands for pyrazinamide, E stands for ethambutol, R stands for rifampicin, and O stands for levofloxacin. Okay? So do go through the TB drugs. They could come in the exams as well. Okay. Let's go to one more numerical. Let's try to revise the sensitivity and specificity formulas, everybody. Let's try to revise the sensitivity and specificity formulas. So can you answer this one? Okay, what's the answer to this? Okay, what's the answer to this, everybody? So the answer to this is let's see what is the answer to this. So what are you writing? Let me see. Have you written your answer? Okay, I got the answer. ठीक है, तो यहाँ पे देखते हैं. A screening test was carried out among 114 people, out of which 15 have a disease. The test showed 22 people tested positive for the disease, among which 14 actually had the disease. What is sensitivity? Now, as soon as you get the question, you have to remember, recollect. Don't panic when you get the numericals. Try to recollect. Now, you know what is the formula for sensitivity, everybody? What is the formula for sensitivity? TP upon TP plus FN. What is the formula for, and let's make a 2x2 table also. Disease, I've always told you, comes on the column side, yes, no. And screening test result, guys. Screening test result comes on the row side, positive, negative. Now, what is the order of ABCD? If you look at the videos of the classes, you will see I've told you ABCD का order क्या होता है? What is this? A, B, C, D. So, what is this, guys? This is a Z. This is a Z, never an end. And A क्या है? A is TP, B is FP, C is FN, and D is TN. On the first row, we have all positives. On the second row, we have all negatives. Okay? Now, try to figure out here. A screening test is carried out among 114 people. So, first thing that you have to remember is 114 क्या है in terms of A and B and C and D. So, this is A plus B plus C plus D. Now, out of which 15 have the disease. Now, where is this 15 going to go? Is it A plus B or is it A plus C? It is disease, yes. Disease, yes. How many people have the disease? 15. It is disease, yes. Out of which there are 114 people, out of which 15 have the disease. So, disease, yes. किस में present है, guys? 15 people में. Then, the test showed 22 people tested positive. So what is 22 everybody? Is it A plus B or is it A plus C? 22 people tested positive means this one, A plus B. This is 22. Out of which 14 actually had the disease. So what is 14 guys? The 14 over here is A. Okay? Now what is sensitivity everybody? Sensitivity is nothing but TP upon TP plus FN. You already have this 14 upon 15 into 100. Definitely it's not exactly 97. It's going to come to 93%. So what I'm trying to tell you is guys, whenever you get a question, relax. Recollect the formula, then see what are the values that have been given to you and what are the values that have not been given to you. Try to figure out what it is. Like over here 15 have the disease. So what is 15? We can say that 15 is A plus C. What is 22? It is A plus B, and accordingly mark your answers. Okay? And what are the formulas for specificity everybody? Let's just write the formulas once. It is nothing but Tn upon Tn plus Fp into 100. All those who do not have the disease. PPV में सारे positives हैं. So it is TP upon TP plus FP into 100. Everything positive. And what is guys NPV? NPV is Tn upon Tn plus Fn into 100. Everything negatives. Okay? Alright, moving to the next one. Which factor has the greatest impact on positive predictive value? Which factor has the greatest impact on positive predictive value? What are you going to mark over here? Again, it's based on one single equation that you have to remember, which is how and why. We are not getting into that for your exams. PPV is directly proportional to prevalence. NPV is indirectly proportional to prevalence. And one more thing, sensitivity and specificity of the test. Sensitivity and specificity of test, okay, are independent of prevalence. Sensitivity and specificity of the test are independent of prevalence of the disease. याद रखना, prevalence जो भी हो, if like whatever is the prevalence, suppose some community has a prevalence of 90% diabetes, the other one has a prevalence 50% diabetes. If I am using RBS, its sensitivity and specificity is going to remain the same. They don't depend on prevalence. But greatest impact on PPV over here is prevalence. Okay, so remember this equation. They can give you a conceptual question also here where you will have to just apply this equation. PPV is directly proportional to prevalence, NPV is indirectly. Back to numerical. Biostat. I'm not going to leave today guys without solving biostats numericals because it'll any which way help you in practice and give you that confidence. So now I have given you to calculate confidence interval. Anybody, how do you do this? Of course, I'll tell you Medico, just make a note in case series and parallel is not covered. I will definitely tell you at the end. Don't worry at all. Okay, just lick low so that we don't forget that we have to discuss test in series and parallel. Okay, now what is the answer over here? IOP was measured in 400 people. Mean was found to be 25 mm Hg. Standard deviation was recorded as 10 mm Hg. 95% confidence interval. All I want you to remember confidence interval ka formula. Now, confidence interval, what is the buzzword? Whenever you get a question on confidence interval, you will not be including standard deviation. You will be talking about standard error. You will be talking about standard error. Now, there are two things, okay, measures of dispersion, you have standard deviation, you have standard errors. Now, standard deviations are used for individual observations and standard errors are used for sample observations, okay. When I'm talking about confidence interval, it means I have to include standard error. Now, if you remember a formula, good bunny, standard error of mean. What was the formula for standard error of mean, guys? Standard deviation upon square root of n. And what is the formula for confidence interval? 95 matlab our z score would be taken as 2. Okay, so it is confidence interval is mean 95%. So mean plus minus 2, mean plus minus 2 standard error of mean. That means mean plus minus 2 into standard error of mean के लिए ले लेंगे standard deviation upon square root of n. Now over here if you see what is the mean guys, 25 plus minus, let's write it here. Okay, the mean is 25 plus minus 2 into standard deviation is given to you as 10. And what is the total number of people that has been given to you guys? 400, square root of 400. So what does this become? 25 plus minus 2 into 10. Square root of 400 means square root of 400 हो गया तुम्हारा 20. Right, so this is 20. So 10 to this becomes 1. So it is 25 plus minus 1, which is 24 to 26. So what is your answer? Option C. What do you have to remember over here? Whenever you get a question on confidence interval, you will have to consider standard errors, and standard error होता है standard deviation upon square root of mean. Now I am 95% confident that intraocular pressure, what is the meaning of this? बस एक बात सुन लो, 95% confident that intraocular pressure of the population from which we had taken the sample lies between, of the population lies between 24 to 26 mmHg. ठीक है? That is your standard error. This confidence interval में you will either take standard error of mean or proportion. If they give you mean के terms में, standard deviation के terms में, you will take standard error of mean. Otherwise there is one more thing, standard error of proportion, in which the formula was square root of PQ by N. P was the prevalence and Q was 100 minus P. Clear? Can I move to the next question? Give me a thumbs up if you understood this one. Can we go to the next one, guys? Give me a thumbs up. Give me a thumbs up. Everybody, did you all understand this question? Then we're going to proceed to the next one. Okay. So the next question for you is, okay, just make a note, Shravani, we will discuss this confidence interval and sample size also. Okay, I will tell you, just make a note of it. Let me do the questions, then we are going to talk about it. Okay, what is the answer to this, guys? What is the answer to this, everybody? What is the answer to this? If you see, as per NIS, guys, as per NIS, the question is, as per NIS, which vaccines are indicated at the first visit for immunization of a 13-month-old baby who has not been previously vaccinated? Now, rather than immunization schedule, they ask about delayed immunization. They ask about, am I visible to everyone? Okay, yeah, now I think I am. So, for delayed immunization, guys, you have to remember that what are the vaccines? This is a topic of delayed immunization. This is a topic on delayed immunization. So, if you have to talk on delayed immunization, remember what are the vaccines that can be given till 1 year? What are the vaccines? So, till 1 year BCG. Okay, till 1 year BCG. What else? BCG. We will give BCG. We will give Penta. We will give Rota. BCG, Penta, Rota, PCV and IPV. FIPV. They are given till 1 year. Okay. Till 5 year, everybody, we are going to give measles, MR, OPV, vitamin A. Till 7 year, we are going to give DPT. Till 15 years, we are going to give J. Clear? We are going to give J. Now look over here. 13-month-old, never been vaccinated. So if you look at option B and option D, you have BCG here. This is out of the box. Under the NIS, BCG can be given till 1 year. And when we give BCG till 1 year, guys, it is known as direct BCG till 1 year, because we don't have to perform a tuberculin test. We'll give it straight away without performing a tuberculin test. So here B and D mein BCG tha, penta tha, rota tha, this is out of the box. Now if you look at option A, again you have pentavalent, guys. Pentavalent can be given till 1 year only, so this is out. So what is the correct answer over here? OPV first dose, DPT ka first dose and measles ka first dose, because OPV and measles can be given up to 5 years. DPT can be given up to 7 years. Did you understand this question? Everybody, will you be able to answer delayed immunization? Please don't go for that option which shows maximum number of vaccines. No, that is wrong. You have to actually follow this guideline and accordingly mark your answer. Okay? Alright, let's go to this one. Again a calculation. So for this, I have kind of not given you, like I have not given you, tell me whether A is true, like what are the correct options. You have to calculate each one and you have to tell me whether option A is correct, whether option B is correct, whether option C is correct, whether option D is correct. Now what did I want to revise over here was, you were given a village 1, its total population, mean age and standard deviation. You were given a village 2, its total population, mean age and standard deviation. Then I'm asking you variation. So that means what are we supposed to calculate in this question, guys? Coefficient of variation. क्या calculate करोगे? Coefficient of variation. Now can anyone in the class tell me what's the formula for coefficient of variation? Everybody, what's the formula for coefficient of variation? COV का formula क्या होता है? Standard deviation upon mean into 100. It's always expressed in percentage, and don't write mean upon standard deviation. It is standard deviation upon mean into 100. So let's calculate it. Let's calculate for village 1. Village 1 has a standard deviation of 2 and mean population of 20 into 100. So this is 5 2s are 10%. So variation in village 1 is 10. Correct? Yes or no? Let's calculate for village 2. What is the standard deviation, guys? Standard deviation is 1 year. Mean age is 40 years into 100. So what will it come to? 4 2s are 8 and 2.5%. So again option B is correct. Now if you see option C, village 1 has higher variation. Of course, village 1 में 10% था, so this has higher variation. Village 2 has higher variation? No. So which are the correct statement? A, B, C are correct. A, B, C are correct. Just wanted to revise this formula, guys. Coefficient of variation, the formula is standard deviation upon mean into 100. And what is the formula for variance? What is the formula in case they ask you calculate variance? Variance is standard deviation square. What is the formula for range? What is the formula for range, guys? Range is maximum value minus minimum value. We are sitting for biostats, we are sitting for AIMS paper. We have to revise in and out of biostats, guys. Maximum minus minimum value. What is the correct formula for standard deviation? If sample size is less than 30, standard deviation is summation mu I minus mu whole square divided by n minus 1 if sample size is less than 30. If it is not less than 30, then it is by n. Okay, everybody, couple of formulas we've revised. I hope you will be able to do it, everyone. Okay, one last numerical. Can you see this one? Yeah, an easy one of the easiest that you can get. You can get it in NEET PG also. You can get it in FMG exams also. You can get it in INI-CET also. Okay, coefficient of variation and variance, more chance in INI-CET. Box and whisker plot, INI-CET. The other things that we did, mostly number needed to treat, INI-CET. ये वाला question किसी भी exam में आ सकता है. So let's quickly apply what was the formula for normal distribution, guys. You just just have to revise this. Mean plus minus 1 SD covers 68% of observations. Okay, mean plus minus 2 SD covers 95% observation. Mean plus minus 3 SD covers guys 99% observation. And एक बार एम्स पेपर ने सेपरेटली पूछा था मीन प्लस माइनस 1.64 SD covers 90%. This is one additional information. Okay, now in case exam may they ask you 72% observation will be within how many standard deviations. So now you can't learn all the values. So you can see that if they ask you 72%, it is going to lie between 68 and 95, and it is going to be more towards 68. So it's going to be like 1.2, 1.12, something like that. You can't memorize the entire table which is there in biostats, but from these values you have to make an idea. अगर बोल दिया कि 98% observation is going to lie within, so you will have to go closer to 3 SD. So here the question was 2 standard deviation. So when I have 2 standard deviation guys, I'm going to use this one. Mean is 82 plus minus 2 into 1.5. So that is 82 plus minus 3. So how much is that going to come? 82 is, this is your answer, everybody is A. 100% observation में infinite, mean plus minus infinite SD, mean plus minus infinite SD covers 100% of observation, that is infinite. And remember, normal distribution curve में the tails of the curve will never touch the baseline. For this, mean is equal to 0 and standard deviation is equal to 1. Okay, let's move to the other question. Let's move to the next one. Are you ready guys? Okay, what's the answer to this? Which of the following health programs does the logo represent? Yeah, normal distribution, mean, median, mode, all are equal, Chaitanya. And suppose they ask you what is the difference between normal curve and standard normal curve. So please remember, if I ever say standard normal curve, for standard normal curve guys, mean is equal to median is equal to mode. All are equal, but that equal is equal to 0. Normal distribution में mean, median, mode all are equal. But if you ask standard normal curve, it is mean is equal to median is equal to mode is equal to 0. Yeah, so what's this logo? That's absolutely correct. Janani Sishu Suraksha Karyakram. What was the thing? Now maternal health initiatives, these INI-CET exam is fond of given. And in JSSK guys, there were 2 buzzwords, free services plus we were also providing services to sick infants. We were also including sick infants. Free and we were also including services to sick infants. Now look at this slide. If you see, I have just noted down the free initiatives, free drugs, diagnostics, free diet for 3 days during normal delivery, 7 days C-section, and free transport, free referral, everything free. Okay. A couple of logos that they are very fond of asking in your INI-CET. This one, as you can see, it's written Pradhan Mantri Surakshit Matritva Abhiyan. On the 9th of every month, what is being happening? Free antenatal services are provided to women in 2nd and 3rd trimesters to identify high-risk pregnancy. This one is Quality Assurance Lakshya Improvement of Labor Room Initiative. This one guys is Pradhan Mantri Matru Vandana Yojana. What is being done in Matru Vandana Yojana? So in Matru Vandana Yojana, we are providing a cash incentive of rupees 5,000 to pregnant women above 19 years of age and for the first live birth only in 2 installments. That's the update. Earlier it was 3 installment. But if the second child is a girl child, then we will give a single installment rupees 6,000. This one is the latest Suman. What's the full form of Suman guys? Surakshit Matritva AN is Ashvasan. They can ask you the full form. So everything is free over here. But in this we also had a Suman charter. That means we spoke about quality based service, addressing their grievances. And for the first time in Suman program, women up to 6 months, post delivery included. Post delivery, we included women up to 6 months. Of course, we are also taking, everything is free. We are taking care of free antenatal services, TD vaccinations, but women usually 6 weeks post delivery ली जाती थी हर स्कीम में. Here women up to 6 months post delivery were included. ठीक है, 1 साल के बच्चे को भी इसमें लिया जा रहा है इन सुमन. Is it clear everyone? Chalo. Okay, next look at this. I had to discuss JSY because JSY पे question अभी भी आता है. So can you read and can you figure out this thing? Age criteria, Minhas, like I just mentioned, no, 19 year and above. Like JSY mein, there's no age criteria. There's no cutoff on the parity. But if you talk about Pradhan Mantri, this thing, Matru Vandana Yojana, in that age criteria hai and number of children bhi hai. It's given up to first live birth only. But in case the second baby is a girl child, then we will give a cash incentive of rupees 6,000 at one installment. Okay. Alright, so now what is the answer to this one? Which of the following is not true regarding JS5? So I'm getting mixed answers. B, C, somebody is writing B, C. Sabse pehle, what is the purpose of Janani Suraksha Yojana? The purpose was to promote institutional deliveries, and to promote institutional deliveries, guys, what is being done? We are providing incentives, okay, to pregnant female as well as to ASHA workers. Now look at each statement. Launched in 2005, yes. 2005 was also a time when ASHA का concept आया. All BPL women delivering at home get an incentive of rupees 500. This is correct. This is true. Thank you, Ritika. God bless you so much. Many congratulations on achieving a wonderful rank in the NACO exam. Thank you so much. Means a lot, dear. Okay, now let's go back. Now guys, you might think that JSY is meant for promoting institutional delivery. Why would we give incentive in case of home delivery? Yes, if she doesn't agree, we are giving incentive in case of home delivery also, up to 500, but only to BPL women, not to everybody. Incentives are provided only to pregnant females delivering in institution. And look at the last one also. In high performing states below poverty line, SC/ST women delivering in government health centers and accredited private hospitals are only given incentives. Yes, in high performing states we are only giving to below poverty line, but in low performing state incentive is given to all women who are delivering at health institution. So D is also right. Now some of you did get the correct answer. The correct answer was C. Incentive is not just given to pregnant female, also it is given to ASHA worker. Also to ASHA worker. Is it clear? Also to ASHA worker. And in JSY, we will give the incentive irrespective of the number of deliveries. We will number of time the woman is pregnant, irrespective of the age. And if she agrees to, like if she still wants to get a home delivery done, we will again give her an incentive of 500, but only to below poverty line. And you should go through this table as well as, guys, high performing state, low performing state, rural areas, urban areas. Always remember, ASHA will get less money than the pregnant females, and the money in urban areas or rural areas will always be more than the urban areas. So over here, if you see, ASHA package in rural areas is 600 and in urban areas 400. Incentive, pregnant female is going to get the maximum in rural areas, in low performing state 1400. Half of that 700. Urban areas 1000 and 600. You must revise these incentives. You should know the low performing states. They are the Bimaru states, guys. Okay, Bihar, Jharkhand, MP, all right, Assam, UP, so they can mention those states in the name. Then you will understand that they are low performing state. Give me a thumbs up, everybody. No bar on the number of pregnancies, age of the woman, JSY hamesha milta hai. But yes, in high performing state, it is only given to BPL, SC/ST women. In low performing state, it's being given to everybody. Give me a thumbs up, then I'm going to proceed to the next one. Okay, let's see if you can mark this one, guys. A 65-year-old male comes to the OPD due to hematuria. Cystoscopy reveals bladder cancer. Past occupational exposure to which of the following chemicals is associated with this condition? So we just had to know this one because this is common. Benzidine, D is for bladder. Benzene is for leukemia. Leukemia is ethylene oxide also. Bladder mein you can see the word D. Vinyl chloride is liver. Okay, vinyl chloride is liver cancer. Some of the information, and whenever you suspect someone suffering from like us complaining of bladder cancer, the first thing that you have to do in them is a urine investigation to check out for painless hematuria. Okay, let's see the answer to this one, guys. Which of the following steps is excluded from the steps approach of World Health Organization? Now, why do we have the steps approach, first of all, which was given by WHO? Why do we have the steps approach? So why do we have the steps approach, guys? Steps approach is, why do we have the steps approach? So the steps approach is for surveillance. Okay, the steps approach is for surveillance of risk factors for NCD. Surveillance of risk factors for NCDs. Okay, of NCDs. It's nothing meant to do with treatment or therapeutic management. Okay, so like you can see, in the first step, one second guys, look at the image. In the first step, you're going to take information on psychological behavioral assessment. So in the first step, we get a questionnaire fill. So we take assessment on lifestyle, psychological, and also behavioral assessment. In the second step, we take the physical measurements. Physical measurements मतलब क्या होता है? Anthropometry, height, weight, waist circumference, hip circumference, and this is lab. So what we are trying to do is we are trying to do a surveillance of risk factors. It has nothing to do with treatment. So what was the correct answer over here? Therapeutic management. Okay, proceeding to the next question, guys. Match the following STI kits. What is the update in STI kits? Do we have, how many kits do we have now? Do we have 10 kits? Do we have 7 kits? Do we have 8 kits? Do we have 9 kits? How many kits do we have, everybody? So over here, if you can see, guys, lower abdominal pain. Can you see me, guys? Am I visible, everybody? Yeah, okay, now I am visible. Chalo. So I hope you all know, now we have 8 kits. How many kits do we have? We have 8 kits. How can you remember? See, it's very basic. Okay? If you talk about kit number 1, guys, kit number 1 has a very dull color, grey color. Initially, and grey ke saath everything gels. Okay. So initially we used to have anorectal discharge also in kit 1, but now it is changed. So यहाँ पे है UD, urethral discharge, and CD, cervical discharge. And the drugs that we can give in kit 1, the same can be given in kit 8. We can give Azithro, we can give Cefixime. Kit number 2, ladies first, green color. So green color, vaginitis. Secnidazole, fluconazoles. Kit number 3, no discharge, ulcer. But the good thing is it's not herpes. It's not herpes, non-herpetic ulcer. And even better, penicillin is acting on it. So since penicillin is acting on it, everything is happy. Penicillin काम कर रहा है, peaceful color, white. Kit number 4, it is also non-herpetic ulcer. But problem क्या हो गया? Allergic to penicillin. Here penicillin acts. But here what is happening? Penicillin is not acting. So you're going to go for a little darker color, blue. Because allergic to penicillin. Allergic to penicillin. Then comes danger. Kit number 5. When it is herpetic ulcer, guys. And you know the color of danger is red. Acyclovir has to be given. What about kit number 6? Now after discharge and ulcer we are left with lower abdominal pain. So over here it is lower abdomen pain. So from L it becomes what, guys? Yellow. Kit number 7, we all know it is black now, buboes. So it is buboes, so it is black. And what is the latest development? Kit number 8. Kit number 8, guys, is a brown color kit. And this one now has ARD, anorectal discharge. Earlier ARD was in green color. So you should know, and I hope you've got the correct answer. Lower say yellow ho gaya, urethral discharge, the first one, urethral and cervical discharge. So it is this one. Non-herpetic, good, everything is okay. Ladies first, vaginitis, green color. So what is your correct answer over here? So the correct answer over here is option C. Do revise STD kits, they turn up in the exams. Okay. Now 2 more diseases that we are going to take up is dog bite management and tetanus. So let's see this. One we have already done, pneumonia we've already covered. Let's have a look at the tetanus also. So the question is, a 40-year-old male presents to the emergency department with a crush injury on his legs. He says he has received last dose of TT vaccination at the age of 33. What is the preferred treatment for this patient? Now, if you remember, whenever we talk about tetanus, you have to divide the wounds into 4 categories, and you have to look at whether it's a clean wound or unclean wound. So let's look at this again. Clean wound, unclean wound. What is category A? Full immunization the person has received within 5 years. Whether clean or unclean, only wound care. Then it is category B, full immunization beyond 5 years but within less than 10 years. So if you talk about clean or unclean, wound care plus TT single dose. Now it's a trauma case, so it is TT single dose. Then full immunization more than 10 years. Here is the problem. In clean wound, you don't have to add immunoglobulin, but in unclean wound, you will also add immunoglobulin. And D is when nothing is known, so we have to do TT complete course, but in unclean wound, we will also add immunoglobulin. Now, how do you come to the answer? Remember one point. Immunoglobulin is only given in unclean wound. Immunoglobulin only given in unclean wound. It's not being given in clean wounds. No matter kuch bhi ho, immunoglobulin is given in unclean wound. So whenever you get a question like here, 40-year-old male presents to the emergency department, crush injury hai. He says he has received a last dose of TT vaccination at the age of 33. So so if you see this one, which category is he falling into? He has received it more than 5 years ago but less than 10 years. So he is in category B. Now category B, whether clean or whether it is an unclean wound. What has to be done? See, category B, whether clean, unclean wound. TT single dose. So what is the answer over here? Wound care with single dose of TT. You don't have to do a full course of the vaccine. And also I told you, you will never add immunoglobulin in the unclean wounds and in the clean wounds. Immunoglobulin will only be added for the unclean wounds. Clear? So tetanus. And you also remember one point, tetanus is the only disease for which source of infection and reservoir of infection is the same, and that is soil. Okay. Moving to the next one. Let's see if you can do this. Dog bite management, guys. What's the answer over here? Can anyone quickly tell me the answer over here? The question is, a 5-year-old boy received a full no herd immunity. Very good. That also, yes, good. A 5-year-old received a full course of rabies vaccine in December 2018. November 2019, his fully vaccinated pet dog bit him on the toe, causing bleeding. Point number 1, even if somebody is bit by the pet dog, you will always say, please get vaccinated. Even suppose somebody goes to his friend's place for some party or something. The friend has a dog. Now, the dog bites somebody. But your friend is saying that, oh, no, my dog is vaccinated. Never. You will get the person vaccinated. Because rabies is 100% fatal. In no way we are going to take a risk. Now, over here, this was a case of re-exposure. And what do we know in case of re-exposure? Again, the dog bite. So, you have to look at the duration. If it is within 3 months, only wash the wound, But if it is beyond 3 months, in this case, now if you see, re has 2 letters, so we are going to make 2 visits to the doctor. The first one, day 0 is always the first dose of vaccine intake, day 0 and day 3. So यहाँ पे आंसर क्या हो जाएगा? 2 doses of vaccine on day 0 and day 3, everybody. 2 doses on day 0 and day 3. What is the regimen for post-exposure prophylaxis? Post-exposure prophylaxis in India, we prefer the updated Thai Red Cross regimen. Thai Red Cross. That is in India. Now, I say India yaad kar lo, and this is an intradermal regimen. Intradermal, I've always told you the dose is 0.1 ml, goes day 0, 3, 7, 28 days. 2 sites simultaneously. In India, in National Rabies Control Program, this one is it. Thank you so much. God bless you, dear Maitreya. Many congratulations. Okay. Chalo, thank you so much. और अगर प्राइवेट हॉस्पिटल्स में जाते हैं, they give us a SN regimen. For SN, now you can see, make this N and M intramuscular 0.5 ml, and SN has how many letters? 5 letters. So here it was 5 visits, guys. Day 0, 3, 7, 14 and 28 days. Over here it is intramuscular regimen. Re-exposure is this. And if you have pre-exposure prophylaxis, pre-exposure will be given to doctors, veterinarians, basically forest officer. Pre has 3 letters, so 3 visits, 0, 7, 28 days. Give IM or ID, it's immaterial. Clear? Give me a thumbs up, everybody. Best way to control dog rabies is vaccinate the dogs. 85% of dog population is accessible in an area. ठीक है? Immunoglobulin, human immunoglobulin दिया जाता है, and the dose of human immunoglobulin is 20 international per kg, which is mostly given around the wound site. Immunoglobulins can be given up to 7 days from day 0. ये कभी आपसे पूछ सकते हैं. ठीक है? Okay. Going to the next one. Some more questions we are left with. So let's have a look at this. What is the answer to this? Patient on heart, patient on heart क्या होता है? What is heart? Presence with, complains with fever and expectorant cough for 2 weeks. What is the first investigation of choice? What is the full form of heart? Highly active ART regimen. ठीक है? So what is the question over here? Person living with HIV, most common opportunistic infection in India is TB, guys. So when I will have a person living with HIV, I will do a CB NAT for him. So your answer is CB NAT. Let's do one more thing question over here. Now suppose the person comes TB positive. How will you manage it? HIV TB co-infection. So over here, what is the first thing that we have to start? Start ATT, then ART 2 weeks later. Then ART, how many weeks later, guys? 2 weeks later. It usually takes 2 to 6 weeks to shift them to ART, and it is done to prevent iris immune reconstitution syndrome. To prevent immune reconstitution syndrome. Very good, Ashu. Highly active antiretroviral. Very good. Okay, and suppose the person is TB negative, guys, then we cannot have the person developing TB. So this is preventive mechanism that we will have, TB preventive therapy. So in TB preventive therapy, now we will give 3 months isoniazid plus rifampicin weekly it is given. Okay, this you should remember. Okay, this you should remember. Now come to the next question, everybody. Let's see what is the answer to this. This came last time also, so I had to revise HIV a couple of times. So let's see the answer now. What are you going to write over here? Which of the following is not to be targeted under the program? Now, which program does it represent? If you see, 3HP, that's correct, Doc Vishnu. Great. So now, what is it that you're going to... Guys, try answering this. I'm just connecting another pencil. Give us 1 minute, please. Till we do this, can you give me the answer to this, everybody? Which of the following group of individuals is not to be targeted under the program? So what is the answer? Now this, as you can see, everyone is a red ribbon, right? You can see there is a red ribbon. Red ribbon, that means we're basically talking about HIV program. Now although this is not the logo of HIV, of the National AIDS Control Program, guys, the logo of National AIDS Control Program is NACO, National AIDS Control Organization. Okay, so what's the answer to this question, everybody? What's the answer to this question? Now we all know National AIDS Control Program is going to target migrant, transgenders, commercial sex workers. They are not going to target industrial workers. They are not going to target industrial workers. Now, what is the high risk group for HIV, guys? What is the high risk group for HIV? There are 4 high risk groups. There are 4 high risk groups, or there are 4 high risk groups, or I can also call them as core groups. What are the 4 high risk groups or the core groups? Commercial sex workers, men having sex with men, MSM, transgenders, and injectable drug users. These are the core groups. And when we have to talk about the bridge population, ठीक है. So these are the 4 high risk groups: commercial sex workers, MSM, transgenders, injectable drug users. What is the bridge population? What is the bridge population, guys? So the bridge population is single male migrants, single male migrants. The bridge population is single male migrants, truck drivers, and also we can say clients of commercial sex workers. Okay, clients of commercial sex workers. And guys, one more thing, how do we assess the prevalence of HIV in general population? So to see the prevalence of HIV in general population, ANC clinics or ANC females are used as proxy indicators. We will do a surveillance proxy indicators. We'll look for HIV cases among antenatal females and we will extrapolate it to the general population. Proxy indicators for HIV prevalence in general population. And one more thing, guys, what is the special term given to the surveillance that we conduct for HIV? We can't do active surveillance in HIV. Passive surveillance also lacks in HIV. So what is the particular name of the surveillance in HIV? Sentinel surveillance. And exam may once upon a time, guys, they had also asked what is the frequency of the sentinel surveillance. So it was biennial. Biennial means once every 2 years. ठीक है. Nowadays for surveillance of HIV, STD clinics are not considered. All right, that could also, like, which group do you not consider? STD clinics. Okay, let's see another question. PPTCT, guys, prevention of mother to child transmission of HIV. So what are you going to mark here? A baby is born to a HIV positive mother. Mother claimed that she is not on ART. What should be the management of the baby? Now, this is circulating a lot, guys. Who is a low risk infant? Who is a high risk infant? So, what we have to do over here, you have to put the baby both on syrup nevirapine as well as zidovudine. But I want you to show a slide. Look at this slide, guys. I want you to read who are the low risk infants and who are the high risk infants. This is important for everybody. Whether you're appearing for INI, NEET PG, FMG, UPSC exam. Okay. See, low risk infant, all right, low risk infant is an infant who is the low risk infant? Born to mothers with the low viral load, which is detected after 32 weeks of pregnancy till delivery. This is also one way of saying. Or the mother on ART, mother is on ART, or she has taken ART at least for more than 4 weeks. Either we will say low viral load, ठीक है, born to detected after 32 weeks. Who is the high risk infant, guys? Born to HIV positive mothers, not on ART, with viral load not estimated beyond 32 weeks, viral load not suppressed after 32 weeks, or diagnosed with HIV within 6 weeks of delivery. We can also say no ART or ART less than 4 weeks. You should know this because they're given the options. Now, if you have a low risk infant, you will put on syrup nevirapine. You can also just put on zidovudine syrup also, but we prefer nevirapine. Irrespective of the type of feeding, guys, ठीक है, irrespective of the type of feeding, whether breastfeeding or replacement feeding, it is given up to 6 weeks. But for a high risk infant, we will add both syrup nevi as well as syrup zidovudine. If the person is on, if the baby is on exclusive breastfeeding, this is given exclusive replacement feeds, that means stop feeds from birth to 6 weeks. But if the baby is exclusive breastfeeding, this is given till 12 weeks. One more point that INI-CET asked, no mixing of feeds allowed, no mixed feedings allowed, no mixed feedings allowed for a baby born to a HIV positive pregnant woman. Okay, kabhi mixed feeding nahi karna, either replacement feed completely or breast milk completely. ठीक है, and we will avoid feeding from the bottle. If the baby is on replacement feeds, we will give from katori chammach, avoid from a bottle. So these are certain guidelines that you should know for your exams when you prepare. Now remember, so over here she is not on ART, so the baby is a high risk infant. So here we are going to add both syrup Navy as well as syrup Zidovudine. In case of exclusive breastfeeding, give it till 12 weeks. In case of replacement feeds, give it till 6 weeks. And I hope you know PPTCT. That is measured, okay? PPTCT. The easy way over here to administer Medico is just ask what was the duration of ART. PPTCT contributes 5% of total burden. And what is the efficiency of this route? This is important, okay? Efficiency of the route. Efficiency of the route without treatment. If you don't put an HIV positive mother on treatment, it is 30%. With treatment, if she is put on treatment, these values are asked, guys, it decreases to below 1%. Okay, you should know these couple of things from PPTCT. Give me a thumbs up. Did you all understand prevention of parent to child transmission of HIV? Okay. Another thing important for INI-CET is the rickettsial diseases. What's the answer? So I wanted to revise the table for rickettsial disease over here. A soldier presents with fever, rash, no rash on palms and soles, and myalgia. There is also history of louse infestation. That's your buzzword. Louse infestation in soldier barracks. So now if you have louse, that means what are we talking about? Epidemic typhus. Okay. Now over here, if you talk about louse, that's the disease. What is the agent? Epidemic typhus is Rickettsia prova-ziki. If you talk about endemic typhus, the agent is Rickettsia typhi and the vector is rat flea. So what I want you to know, this you can definitely read over here. This is epidemic typhus or louse-borne typhus. Agent is prova-ziki. That's okay. Okay. So this you can read from here. It leads to chronic infection, state of relapse, Brill-Zenser's disease. That could also come. But look at this table. This is an important table, a go-to table for INI-CET, guys. From the typhus group, epidemic typhus is what has to be revised, louse, and they trouble you by asking the host. Over here the host is human. Alright, prova-ziki, murine typhus is endemic. Now how can you remember? See, epidemic typhus, it's an epidemic, and louse. Have you heard of something known as head louse? Agar kisi ko head louse hai, it spreads like an epidemic. So remember louse, epidemic typhus. Okay, then endemic typhus or murine typhus. What is the agent? Rickettsia typhi. Now typhoid is endemic in India. Alright, so typhi is kind of representing endemic typhus. Vector is flea. Another thing that I want you to remember from Orensha group, scrub typhus. This is very famous 4-star question, guys. Scrub typhus. Scrub typhus में कौन सा mite है? Trombiculid mite. And trombiculid mite is that beautiful strawberry color one which has the larva form is spreading the disease. How do you identify the larva? By 3 pairs of legs. And over here it's written scrub. So here Orentia, scrub, shushu, shushu, gamushi. Okay? These 3 you should remember. One more from this table, spotted fever में Rocky Mountain and Indian tick typhus. Both of them have vector ticks. But look at Q fever. Q fever agent is also asked, Coxiella burnetii. But you all know Q fever has no vector in humans. Okay, rickettsial diseases, the drug of choice is doxycycline. And another point, for scrub typhus particularly you will see the buzzword eschar. If you see this buzzword eschar matlab ek black, in the wound, in the infection you will see a black dot. Okay, so that again hints this one. Okay, is that clear? So let's move ahead. What's the next question? A study follows 30,000 women for 10 years, selecting some who develop cancers and others as control. What type of study is this? Anybody would want to answer? What type of study is this? Yeah, so what is this? Now see, nested case control is a question of INI only, guys. So far, they haven't yet asked in NEET or FMG exams. Nested case control means I will start with a cohort only. I will start with a group of people. Okay. Now imagine all the babies who are born today in one of the hospitals in Delhi. So they form a birth cohort. Okay. So now I will take up a birth cohort. What am I going to do? I am going to preserve their stem cells. I am going to preserve their blood parameters, hemoglobin, urine, whatever. Okay? So I'm going to do some ANC investigations and preserve everything. I'm not doing any assessment right now. Then I am going to follow them. I will start to follow. So if I follow, what does it mean? It's just that I'm not assessing the details right now, but I am follow. So when I follow, guys, it is prospective in nature. Okay. Now what happens? Let's say after, say example after 50 years, some of them from here, there were 100 newborns who were born today. After 50 years, these 100, 10 developed a disease. So 10 become your cases, okay, and 90 become your controls. So now these develop the disease. So now what I am going to do, there is another rectangle like this. I am going to initiate a small case control study in this bigger cohort. How? I am just going to go back and I am going to access the details of just these 10 cases. Okay, I'm going to access the details of just these 10 cases and see what could be the cause of disease in them 50 years later or 60 years later. Has it got something to do with what happened at birth? Are you understanding? So what are the questions that come? What is the actual design of nested case control? It is a smaller case control in a bigger cohort. It is a smaller case control, everybody, in a bigger cohort. And इसका design क्या है? This is actually prospective in nature. A case control study cannot tell temporality, that cause precedes effect. Here, nested case control can tell temporality because we've collected the exposure details before and then we have followed them. So if a disease occurs later, I can say that because of what happened in the newborn phase, it has led to disease now. So that is a nested case control. Did you understand? It was written over here, study follows 30,000 women for 10 years, selecting some who develop cancers and others who develop controls. And nested case control, everybody, is good for which investigation? Rare investigations. Alright, for rare diseases, everybody, for rare diseases, if you talk about rare diseases, what is your study of choice for rare diseases? You will proceed from effect to cause. Case control. What is the choice for rare exposure, like occupational exposures, where you will compare exposed, non-exposed? So for rare exposure, what is the choice? It is cohort. It is not cohort. Why not cohort, Indra? Because you had a group of people, you followed them, then some developed cancer and others did not. Okay, so I have selected for 10 years, selecting, like I have followed some women for 10 years, selecting some who develop cancers and others as control. So after 10 years, some who developed cancers, they become my cases, some who developed controls, they become my controls. And now I am initiating a smaller case control in a bigger cohort. Did you get, Indra? In cohort, you will have a group of people, you will divide into exposed, non-exposed, follow them for the outcome. Okay, let's go to the next MCQ, guys. Okay, demography transition model. Of course, we have to revise this one, demography transition model. So what is your answer to this question, guys? So we have just a couple of more questions remaining, another maybe 30 minutes to see those questions. All right. Now here you have to tell me, you have to look at the values and you have to tell me country X ko kar do A and B, because we have A and B over here. So what is the stage that they belong to? Now if you see, this is 2011 and this is 2021. So if you talk about country A, guys, birth rate is given, death rate is given. Now if you see the birth rate of country A in 2011, it was 45.6 and it is still 45.6 in 2011. That means birth rate still remains the same. Which is the stage in which birth rate still remains the same? Say stage 2. Yes or no? Death rate, if you see, it is 15.2 in 2011, but it has started declining in 2021. It has become 13.3. So over here, what do we see? Birth rate still same. And what do we see over here? Death rate starts to decline. So which is that phase where birth rate is still the same and death rate starts to decline, guys? ये कौन सा stage होता है? This is of course stage 2. Yes or no? Yes, you can watch it here. So over here, this is what? Stage 2. But look at country B. The birth rate 13.3 in 2011, 2021 also 13.2. In both the decades, it is low. Birth rate low. In death rate 5.6, 5.5. Birth rate and death rate both are low. Now what is that stage where birth rate and death rate both are low? It is nothing but stage 4. So what is your correct answer over here? Your correct answer is option D. Just see, they might not ask you giving you the values. They can just ask you directly also. So you all know, guys, if you look at my hands over here, what is the first stage? Birth rate high, death rate high. What is happening to the population? Population is stable. Okay? And this stage is known as high stationary because both are high. Then what happens? What declines first? The death rate. So this is the death rate. It starts to decline. But birth rate, nobody is bothered about family planning. It is still high. So what is happening to the population? It is expanding, and it is expanding at a faster rate. Then what happens in, so this is early expanding. What happens in stage 3? Death rate declines more, family planning comes into play, birth rate starts to decline. So what is this one now? This one, birth rate for the first time declines in stage 3. This is late expanding. Population is still growing but at a slower rate. Then stage 4, deaths also low, births also low. What is this? Low stationary. Good. One of the most desirable phases, low stationary. Dono low ho gaya, population stable. And what is the last phase? Crude birth rate is below crude death rate. What is happening to the population over here? The population over here is declining. So if you see this question, you can make out what is happening in stage in country A. Birth rate was still the same and death rate has started to decline. That's stage 2. Clear? Will you be able to do this, guys? Chalo. Let's take up one more question on Ayushman Bharat. Anybody? Ayushman Bharat again is favorite for exams. Oh, and one more thing. I hope you know this is the demography transition model, and this one labeling, this is the birth rate, this is the death rate, and sometimes they ask the interpretation also, which we have discussed a number of times. Okay. Now let's see this one, which is not included. So Ayushman Bharat is one of the most ambitious schemes of Government of India. Of course, in this National Health Protection Scheme hai. National Health Protection Scheme, or what we call it as Modi Care. So under this scheme, guys, or Modi Care, financial protection कितना दिया जा रहा है? 5 lakh per family per year is given. Age and number of family members is no restriction, that you should remember. It includes economically weaker sections of the society. It's given to them. We've upgraded sub-centers into health and wellness centers. Now they are being called as Ayushman Arogya Mandir, where we are providing wider range of services. Not just communicable diseases, we are tackling NCDs also. Subsumed within it, Rashtriya Swasthya Bima Yojana and Pradhan Mantri Swasthya Suraksha Yojana? Nahi. This is wrong. Like initially, there were other insurance schemes, okay, which are still running. One was Rashtriya Swasthya Bima Yojana. In that, insurance coverage of 30,000 were given for 1 year, per year, up to 5 family members. This is not Pradhan Mantri Swasthya Suraksha Yojana. What is this Pradhan Mantri Swasthya Suraksha Yojana? This is newer AIMS. Who takes care of our health? AIMS. So Pradhan Mantri Swasthya Suraksha Yojana is creating new AIMS, and upgrading existing aims. Create new aims and upgrading, guys, existing aims. Over here, there was another program which was included, which is Senior Citizen Health Insurance Scheme. Senior Citizen Health Insurance Scheme, in case they ask you. So what we have done is, under Ayushman Bharat, we have included two existing schemes. One is Rashtra Swasth Bima Yojana and one is Senior Citizen Health Insurance Scheme. Then hospitals up to 10 beds can provide services. Yes, private hospitals, not just hospitals. Here the word is private hospitals. If they have up to 10 beds, they can provide services under Ayushman Bharat. Ayushman Bharat is a way to achieve UHC in India, universal health coverage in India. Everyone everywhere should have access to quality and affordable healthcare. That is the meaning of UHC. Okay, can we go to the next question? Alright, let's see if you can do these terms. These terms again are important for your INI-CET. What is active case detection? So, what would you mark over here for active case detection? Active case detection is go to the community, look for cases. So, ASHA workers receive incentive of ₹500 for finding a presumptive TB case. Anybody who finds a presumptive TB case is given 500. Okay, intensified case finding. Now, intensified case finding, I have taught you in the notes also that it is particularly a term reserved for identifying TB cases in certain special groups like diabetics, like HIV. So, initiate screening of TB symptoms. Okay, this becomes this. Community based screening. Now the ASHA worker is going to the community collecting details of risk factors of TB and diabetes. Okay, this is community based. She goes to the community and she gets a form filled. Okay. In which she'll get ₹10 per form and she will take detail about TB and diabetes. And you all know passive case detection is hospital reports. So the correct answer is A. In case they give you some time. Intensified case finding क्या होता है? Active case finding क्या होता है? Community based screening is we're looking to the ASHA workers are screening in the community, particularly for disease like TB and diabetes, in which they fill a form. Community based assessment checklist बोलते हैं उसको. Community based assessment checklist. ठीक है? Alright, let's see one more question, guys. What is the answer to this one? A study was undertaken to find the relation between COPD and smoking. Patient data were collected through records from government hospitals and record of cigarette sale from finance and taxation. What type of study design it is? Now, relation means correlation between COPD's this thing. Now, where are you collecting the data from? You are relying on secondary data and it is being done at one point of time. Where we rely on secondary data, it becomes ecological study design. For cross-sectional study, we rely on which data, guys? Primary data, where I will go and collect the data myself. Ecological mein, the unit of study everybody is population. Alright, let's see one more question from Anemia Mukt Bharat. That is a highly probable question that could come in your exam. So, what is the answer to this? A pregnant female less than 34 weeks gestation reports reports mild to moderate anemia. What is the best management plan according to Anemia Mukt Bharat? What is it, guys? Less than 34 weeks gestation. So here you have to talk about Anemia Mukt Bharat, which again is an important program. I know you all know the intervention, prophylactic iron folic administration Anemia Mukt Bharat mein karte hain. So just to revise it, you know this is Anemia Mukt Bharat, 6 to 59 months. If this is iron, if this is folic acid, guys, this is the schedule. So 5 to 59 months, 20 milligram elemental iron, 100 microgram folic acid bi-weekly, and we will give it in the form of syrup. You don't have to give it in the first 6 months because mothers say bioavailability of iron is amazing. 5 to 9 years, 4 and 4, 45 and 400 microgram. This is given weekly and this is given in the form of pink tabs. 10 to 19-year-old are adolescent, and for adolescent, guys, 60 milligram 500 microgram folic acid. Now this everybody is given weekly, but for when you talk about adolescents, it is blue tabs, iron ki neeli goli. For reproductive age, female 60, pregnant female 60, here also 500. For reproductive age females, it is weekly red tabs, and for pregnant females, it is given daily red tabs. This is started from which trimester? Started from second trimester and given up to 6 months post delivery, given up to 6 months post delivery. All right, remember this. And you know, we also have a strategy in Anemia Mukt Bharat, 6x6x6 strategy, 6 beneficiaries, 6 interventions and 6 institutional mechanisms. So these are your 6 beneficiaries who are getting prophylactic iron folic acid, this thing. And these guys, Anemia Mukt Bharat exam mein aata hai guys, 6x6x6. So we had 6 beneficiaries, we have 6 interventions. These are the 6 interventions. Give prophylactic iron folic acid, do a deworming, do behavioral change, this thing, communication, health education, delayed cord clamping, test anemia using point of care treatment. That means wherever testing is being done, drugs bhi milenge. Mandatory iron folic acid fortified food, and address non-nutritional causes of anemia. This is 6 institutional mechanisms. Alright, they have asked. Now here I asked you about the treatment. So for the treatment plan, guys, you have to divide the gestational age, less than 34, more than 34, mild to moderate. Now mild to moderate, less than 34, if the woman can take IFA, you will put her on 2 tablets, not 1, 2 tablets. But if she is not able to tolerate IFA, then only you will shift her to IV sucrose or IV ferric carboxymaltose. But if the gestational age is more than 34, then of course we have to give IV sucrose or ferric carboxymaltose. But if it's a case of severe anemia, we can't give prophylactic tablets. First or second, third trimester mein to immediately hospitalize. First mein you have to give IV iron sucrose or ferric carboxymaltose. Is it clear, everybody? So over here, what was the question? Less than 34 weeks, mild to moderate, you will give her iron tablets. But if she is not, and 2 tablets, if she is not able to tolerate that, then we will give IV iron sucrose if woman is not tolerating IFA. What is the purpose of iron? Prevent iron deficiency anemia. What's the purpose of folic acid in Anemia Mukt Bharat, guys? Folic acid in Anemia Mukt Bharat. What is the purpose? The purpose is, don't say prevent neural tube defect. It is to prevent megaloblastic anemia. No, not neural tube. It is to prevent megaloblastic, guys. NTD thodi na I'm going to see in an adolescent or in a baby who's already been born. It's Anemia Mukt Bharat. So we have to prevent anemias. Okay. Alright, just 5-6 more question, guys. What's the answer to this? What is stored in the pink zone? Can you see this pink color? Tell me. What is this instrument? I hope you all know this equipment is an ILR. Now, what is it that you place at the bottom of the ILR? You can also get an order to keep the vaccines in an ILR. So, what is it that you place? OPV. Now, how? If you remember, this is an ILR. ILR is always opened from the top. So when you open from the top, what is going to happen? All cold air goes and settles at bottom. All cold air goes and settles at bottom. So at the bottom, what is it that we are not going to keep? ठंडा एयर गया है. So at the bottom we can't keep the freeze sensitive vaccines. We will keep the heat sensitive. Most heat sensitive is reconstituted BCG, but that we can use up to 4 hours. After that it is OPV. So see OPV. Then measles. Heart of ILR, the center of ILR guys, heart of ILR is occupied by TTs and TDs, they can ask you. And on the top, we are having penta and hepatitis, all the freeze sensitive vaccines. Hepatitis is the most freeze sensitive. So where have you kept hepatitis everybody? It's kept at the topmost of an ILR. You should know the order. OPV measles, बीच में तुम्हारा हो गया TTs and TDs, topmost हो गया pentavalent and hepatitis B, and know the logic also. Okay, classification. Which of the following is not a polysaccharide vaccine, everybody? Which of the following is not a polysaccharide vaccine? What's your answer? Hepatitis B, pneumococcal, meningococcal, HIV. Now this is exactly a PYQ from our INI-CET hepatitis B. Hepatitis B is a recombinant vaccine which is asked many times. This is prepared from hepatitis B surface antigen. For live vaccines, you have I love chick embryo, IPV, chick से chicken pox, एम्ब्रियो से जापानीज एनकेफेलाइटिस लाइव, SA 14-14-2, M से मीजल्स, मीजल्स रुबेला, B से BCG, R से रोटावायरस, येलो फीवर, OPV. Killed say you have the pneumonic KILLED. In this I want you to know rabies vaccine is a killed vaccine. Then you had subunit vaccines. In subunit you have using toxoids. ठीक है, TTs and TDs, but you also had using the protein part of the cell wall, so pertussis, influenza, polysaccharide and conjugate, that was meningococcal, pneumococcals and HIVs. Okay, so these are all examples of subunit vaccine. Do go through the classification of vaccines during the last couple of days. What's the answer to this? Not a component of disaster mitigation. Now what is mitigation? And mitigation is a favorite that INI is asking in exams. Mitigation. Now what do you mean by mitigation? Mitigation means prevent hazards from becoming disaster. Prevent hazards from becoming disaster. And mitigation happens guys before disaster strikes. So prevent hazard from becoming disaster. In this we are going to use which modalities? Engineering modalities. Implementing optimal land use, improving building codes, flood mitigation, but developing communication and warning system is not mitigation. It is disaster preparedness. What it is guys? It is disaster preparedness. Mitigation is something that happens before disaster strikes, and in that we are making use of engineering modalities. Okay, one more patent MCQ guys. This patent MCQ is about, this patent MCQ is about which of the following options over here is correct. Now, VVM has a chemical indicator in the circle. VVM is vaccine vial monitor which detects vaccine damage to exposure to heat. Now, does it have a chemical indicator in the circle? It is an outer circle, inner square. दुनिया गोल है, हम लोग उसके अंदर है. So, this has a chemical indicator in the square. Wrong. VVM gives an idea of a number of days for expiry. It has nothing to do with expiry. Even if the VVM is intact but the vaccine has expired, you can still use, if the VVM is intact but vaccine has expired, you can never use the vial. It is the only tool among temperature indicators that is available at any time in the process of distribution. Yes. It indicates whether the vaccine has been exposed to a combination of excessive heat. Yes. It tells about efficacy of the vaccine, not directly. Indirectly tells us about the efficacy, not directly. Expiry date of the vaccine, it tells us about heat, which is a factor of affecting efficacy. So, indirectly. Expiry date can be relaxed if VVM is intact. No, you have to discard. So, this is which is correct guys. 3 and 4 are correct. And the latest NEET PG again gave this question. You know which ones to use. If the inner square is lighter than the outer circle, use. They can say inner square white, outer circle blue, use. Inner square starts to change color but is still lighter. Inner circle light blue, outer circle dark blue, use. Inner circle same color as the outer circle, discard. Inner square darker than the outer circle, discard. And you're going to discard it in blue containers? No, you're going to discard it in yellow containers because अभी इनमें vaccine है. Technically, if they say vaccine vial is discarded in, so if they say VV, vaccine vial discarded in blue bag because it is a glassware. Or if they say broken vaccine vial also discarded in blue. But here it has the vaccine, so it's going into a yellow bag. Okay. Alright, last two questions for the day. Tell me the answer to this. Match the following with color coded bins. Yeah, just a minute, Tapa. Just give me 1 second. I will answer your queries. रोटावायरस वैक्सीन डिटेल मतलब कब कब देते हैं दैट यू शुड नो ऑफ कोर्स. एंड रोटावायरस इंटरसेप्शन कराता है, कॉन्ट्राइंडिकेटेड इन abdominal surgery. It can be given up to 1 year. And it follows now open vial policy. Earlier it was not following. ठीक है. So expired medicines yellow. You're correct. Catheter, expired medicine, this thing. Catheter is a tube, red. Okay, discarded lab report form. अब ये तो general waste है ना. So it is going to go in which color bag, guys? Black. Antibiotic bottle, again if you see, these are all glass bottles. So if you see antibiotic bottles, this is going to go into, what is your answer over here? For something I've like, this is 4, okay? 4. This is going to go into C. So this one is the answer. Anything which is infected, contaminated from our body goes into yellow bag. Mostly all the tubes go into red bag. Syringes without needle, red bag, but syringes with needle, white bag. Contaminated throat swab, yellow bag. Blood लाल रंग का है, जाएगा yellow bag में. Euro bag has the letter R, जाएगा red bag में. Gloves will go into red bag. Okay, so couple of more commonly asked things, expired cytotoxic drugs, they will all go into this thing. Alright, so let's go to one last question for the day, which is types of errors, guys. Anybody can tell me the answer to this? A new drug, yeah, and after this I'll just show you 2 more images and then we'll be done for the day. A new drug designed to lower cholesterol level is being tested on 1,000 participants. The null hypothesis is that the new drug does not affect cholesterol levels. After analyzing the drug, the researcher concludes that the drug doesn't work, but in reality, it does have a small but clinically significant effect. What type of error has occurred over here? Now, you all know there are 2 types of errors, okay? And errors is something that we're going to expect in our exams. Now, there are 2 types of error. एक होता है type 1 error, एक होता है type 2 error. Type 1 error, everybody, is also known as alpha error and beta error. For type 1, I have told you the buzzword is true, and for type 2, I have told you the buzzword is false. ठीक है. Now type 1 error में H0 क्या है? T for true, but R यहाँ पे क्या है, guys? R is rejected. And for type 2 error, H0 F for false, but A, you will remember, A say accepted. This is the definition. Now, how will you understand? See, H0 means no difference. So, in reality, your drug is not better than the existing drug, but rejected means based on the clinical trial, we showed that your drug is better than the existing drug and launched the drug in the market. This is a false positive trial. Your drug is not good, we have shown it to be good. This is very serious. What is type 2? In reality, H0 is false. That means your drug is good. But unfortunately, we could not show that your drug is good and it was not there in the market. So, this is what? A false negative trial. This is what? Less serious. Now, if you see over here, after analyzing, researchers concluded that the drug doesn't work. That means clinical trials showed that the drug is not good. But in reality, what is happening? It is good. That means in reality, H0 is false. Meaning in reality, your drug is good, but unfortunately, on the clinical trial, we couldn't show this. So, what is the type of error that we committed? A type 2 error. Everybody understood? ठीक है, इसमें क्या लिखा हुआ था? इसमें लिखा हुआ था that after analyzing, researchers concluded that the drug doesn't work. Okay, drug काम नहीं करता. But in reality, it does work. So in reality, H0 is false. But we've not been able to show that. In clinical trial, I couldn't show that. So this is which type of error? Type 2 error. Alright, anyone got this question? And the chances of committing a type 1 error is given by, guys, p-value. Okay, alright, one more question. What does consort stand for? Something very important for INI-CET. So for INI-CET, you should know the names of these. This is, if you look at this, I have given you a buzzword, or I have given you a table where we have different reporting guidelines. Case report is CARE, RCT is consort, consolidated standards for reporting trial. Observational studies के लिए we have STROBE, meta-analysis and PRISMA, guys. Meta-analysis of observational studies. PRISMA is actually for both systematic review and meta-analysis. Qualitative research is SRQR, so it is qualitative research. This maybe they can give you diagnostic or prognostic studies. So go through this table. This one is consolidated standards for reporting trial. Last one, what are these two images? Can come in INI-CET, ROC curve. In this, we have to decide the cutoffs, and this is Kaplan-Meier, which tells us about the survival analysis. Alright, they will ask incidence or something, survival analysis. Over here, you have true positive, here you have false positive. This, guys, is sensitivity, and this one is 1 minus specificity. Now, how are we going to identify more the area under the curve, ideal the cutoff. So this is it has more the area under the curve. More area under the curve is given by what is known as Uden's index. So more the area under the curve, ideal the cutoff, which is given by Uden's index. Okay, so here we are going to select this one. Clear, everybody? So yeah, one last question which came in the exam. Tell me the answer to this one. ICER is a unit for which of the following economic analysis? What is ICER, everybody? Yeah, incremental cost effective analysis. So over here, ICER is something which is difference in the cost, whatever different modalities that we have, difference in cost upon difference in effectiveness. Difference in effectiveness, okay. And difference in effectiveness, most comprehensive indicator is QALY. This is something to do with cost effectiveness. Alright. So that's it for today, guys. No matter how hard it gets, never give up. I know you might be, some of you might be confused as to appear for INI-CET, or should you, whatever rank you've got, should you take up a seat? That could also be troubling you guys. So it's an exam. You are prepared if you've sat already for NEET PG. Even if you have a rank in hand and you feel that, okay, last couple of days, just the LRRs that we're giving out, just go through that also, go sit for the exam, and you might get something that could come in your exams, okay? Yes. So now you can just quickly ask me or your doubts. Just give me one moment. Anybody? So, you know, I hope you enjoyed you enjoyed the session over here, guys. Somebody is asking about VVM 2, 7, 14 and 30. See, I would say 2, 7, 14 and 30, everybody, is only kind of, it's only kind of VVM 2, 7, 14, 30. These are, they indicate vaccines heat exposure based on stability. Okay, what does it indicate? Vaccines heat exposure which is based on stability. So if you see the numbers, okay, you can see the numbers over here. So they represent the upper limit in days at a constant temperature of 37. This is upper limit in days, alright. right. This is upper limit in days at a constant temperature of 37 before the vaccine should be discarded, all right. Limit represent upper limit in days at a constant temperature of 37, like somebody asked, before the vaccines could be discarded. Who was asking? Where is your name? Okay, one second. Did you understand? What's your good name, dear? कहाँ गए आप? Yes, tappa. Did you understand tappa? It represents the vaccine damage, okay, like 37 before it can be this thing. Which test is specific or sensitive in parallel or एक बार इसको ठीक करना ना बस. Okay, somebody is asking, so last 5 minutes where I'll take up questions. So first one is droplets and droplet nuclei. Just give me one moment. Droplet and droplet nuclei depends on the size of the droplets, okay. Now, if you have droplets, they are heavier particles. Their size is more than 5 micron. And if you talk about droplet nuclei, it is airborne. The size is less than 5 micron. Okay, so if I talk about droplet, nuclei. So when I talk about droplet, it is more than 5 micron. This is less than 5 micron. So these are lighter. Lighter means they remain suspended in air. But droplet over here is heavier. What happens to them? They fall to the ground. So they travel a distance less than 1 meter. What happens over here? They travel a distance more than 1 meter. Now the question can come, what are the diseases that can get transmitted by droplet nuclei? So you should know it is which was actually asked in AIMS 2020 के आसपास, measles, chicken pox, okay, influenza, COVID, TB. These are certain that follow droplet nuclei. ठीक है? Alright, then somebody is asking, must know recent updates. So basically TB का guideline याद रखना, निक्षा पोषण योजना याद रखना, ₹1000 per month. As such, leprosy classification, we've not really had whatever you had for NEET PG, the same guys, nothing very advanced or nothing very this thing. We know that snake bite is not notifiable, so all those things are there. So you can check out an update video which is on the Prep app also. Okay, specific or sensitivity in parallel. See how you can remember when I talk about series. Second test is applied on those who are positive on the first test. Parallel, both the tests are applied together. So now what happens to sensitivity and specificity? So in series, you're going to apply second test on those who are positive on the first test. So you'll be able to filter out less number of people. So in series, sensitivity decreases, specificity increases. A way to remember. In parallel, all the tests are applied together. So you can think like this, we'll be able to filter out more number of people. So sensitivity increases, specificity decreases. Is it clear? See, yeah, that's what is the catch, because if he's not able to tolerate ART, you will have to stop that for some time and continue with it. Alright, updates we will definitely have. So, any other question? Somebody was asking about confidence interval and sample size. Yes, confidence interval and sample size. So, over here, you know, it's a little tricky. What's a good name? Someone was asking, so I'll just quickly tell. So, you know, it's an inverse relationship, okay, between sample size and confidence interval. जैसे sample size का width बढ़ता है, if the sample size increases, alright, confidence interval becomes narrow. And जैसे sample size is going to, you know, decrease, confidence interval is going to become wider. And we need, you know, we need a bigger sample size, because in that case, the dispersion is going to, the measures of dispersion is going to be low. That means lesser will be the spread of data. Okay, everybody, so that's it. I will see you again some other day. We will again plan out. But as of now, please keep revising and studying, and see you all. Take care. Have a good day. Thank you so much. Hope the session benefits you all.